I gotcha. What exotic location are you in? Where are you?
Good evening, Mayor. We are all here and ready to start the meeting.
Thank you, Madam Clerk. Good evening and welcome to the City Council Special Session Meeting of July 7th, 2020. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Here.
Councilmember Carter,
Here.
Councilmember Patrone,
Here.
Councilmember Hall,
Here.
Councilmember Wilson,
I am here.
Councilmember Scanlon,
Here.
Councilmember Holman,
Here.
Councilmember Scott, Mayor Clark.
Here. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I think we're getting better at that. All right. We have a few items on the agenda before we get to the main event for the evening. So we'll move on to item 3, consideration of ordinance 1920-68 upon second and final reading, an ordinance of the Council of the City of Norman fixing the compensation of the city manager as provided by Article 17, Section 1 of the Charter of the City of Norman, and providing for the effective date for compensation to begin and providing for the severability thereof. I'll entertain a motion to adopt or reject the ordinance on second reading, section by section.
So moved.
So moved.
Second.
Second.
Are there any questions from council regarding this item?
I'm not seeing any, Mayor.
Seeing none, are there any public comments regarding this item?
No, not yet. I'm not seeing any, Mayor.
All right, are there any final comments from council regarding this item?
Looks like Councilmember Hall has a comment, but I just,
Councilmember Hall. Unmute.
motion.
I always forget to do that. Sorry. I just wanted to make some final comments about this. Mr. Pyle is the CEO of the third largest city in Oklahoma. He manages a budget of $288 million and 900 employees. He's the only employee that is hired by the city council. He was hired in July 2019 at a salary level well below the market average, with the understanding that he would be subject to a performance evaluation after 1 year that included a potential salary adjustment based on performance. Even with the additional compensation we are considering tonight, he's still 23.6% below the market average. I was appointed to council in September 2019, so I've had months of personal experience with the manager and how he has performed. I was immediately impressed with his positive, can-do attitude, a breadth and depth of knowledge and experience that he has accumulated in various leadership positions in other cities. He's guided us through an entire year of extraordinary challenges facing the city of Norman, and he's proven himself to be a creative problem solver, open to new ideas to improve delivery of services to our residents, and is extremely helpful in finding solutions to our structural budget issues, as well as presenting multiple budget scenarios as circumstances have changed throughout the year. He's been effective in meeting the challenge with the transition of our public transit system from a partnership with OU to being solely operated by the city of Norman. Under his leadership, satisfaction with the delivery of basic city services continues to improve. He's been relentless in fostering a positive relationship with our federal congressional delegation to advocate for federal dollars that should have been allocated to our city for improving our public transit system, as well as being adept at applying for every federal dollar that the city of Norman is eligible for related to the coronavirus pandemic, which has resulted in millions of dollars being distributed to the city of Norman. His commitment to the job, his high level of energy and enthusiasm that he brings to it every day has resulted in a level of stability under the most trying of circumstances. Most recently, he voluntarily offered to eliminate a position that reported directly to the city manager that has remained unfilled due to the uncertainty with our budget, to create a city equity officer position as recommended by the Inclusive Community Subcommittee of the Human Rights Commission. This position will also report directly to the city manager in the coming year. So these are just a few of the reasons of the many factors I considered while evaluating the city manager's performance this past year that leads me to support the compensation package we're voting on tonight.
Very well said, Councilmember Hall. Anyone else have any final comment regarding this item?
Councilmember Holman?
I second what Lee Hall said. Very, very good comments.
Councilmember Holman?
Okay, yeah, I was just gonna echo that same thing. I don't think I could say that any better than Councilmember Hall stated that. Having been part of the process of hiring a new city manager last year, I can tell you it was extremely difficult. We interviewed 6 finalists. I think there might have been one other, but Daryl was the only one, I think, that did not, there might have been one other, that did not say that we needed to hire an assistant city manager to help him immediately, which would have been another position that would have been well over $100,000, in my opinion. And he was also the cheapest, if I recall, as well, of all the candidates that we interviewed. And he moved halfway across the country to take this job to a state that he is not from. And his only connection really was that his son went to college here. So he has went beyond my expectations in several aspects, in responsiveness and addressing some issues that I felt were not being addressed in the several years that I've been on council under previous administrations. So I feel like his budget management skills, which is one of the primary reasons that we hired him, was to help us get through the situation that we are in with sales tax reliance. And we all know that our budget issues have gone way before COVID started, and for a lot of other reasons. And in my opinion, his leadership has already helped save us from having to make severe cuts and potentially having to make job cuts earlier this year. Remember back in December and January, I was terrified that we were going to have to make some serious cuts and that it might end up costing jobs. And that didn't happen, thankfully. We didn't have to lay off anybody. And I think Daryl being here is a major factor in that. And I think he has saved the city way more money than what this raise is, in my opinion, and he is worth it. And we need someone like him during these times right now, especially. We have work to do and lots to improve on. And I think Daryl has recognized that and he's accepted that challenge. And so I absolutely agree and I do support this. Thank you.
Thank you, Councilmember. Councilmember Wilson, did I see you? All right.
I agree with all of that. Councilmember Hall said it very well, as did Councilmember Holman. I wasn't really going to say anything, but I know there's been some public question as to why now, why at this time, and all that. And I would say that we were lucky to get Daryl at the price that we got him at last year. And I would really hate to see the city lose him right now. Not that he's planning on going anywhere, but I think the next year is probably going to be just as trying as this last year has been. And we need somebody like Daryl with that energy, with that creativity and his positive can-do spirit. I really think he's the right man for the job. And so I support this.
Thank you, Councilmember. Are there any other final comments from council regarding this item? Madam Clerk, you are on mute if you are trying to tell us something.
My apologies. With the process changing, somebody wants to speak under public comments and we missed that before we
Okay.
went to final council comment. So they are now in front of the computer and the public computer.
All right, ma'am, go ahead.
As a citizen of the city of Norman, Oklahoma, in the United States of America, I don't believe a raise should be given to that person simply because of the fact you're taking $850,000 away from the third largest police department in the state of Oklahoma when they're underpaid already, when they are the ones that keep your city safe. And we are one of the safest cities in the state of Oklahoma. And you do not allow them to do their jobs. And before you go giving somebody else some money, the whole consideration of defunding the police of $850,000 has to be settled. And nothing else should be done until that item is already taken care of. And according to most of the citizens in this city, you people, this is not a democratic committee here. It's more like going to Russia or China or Iraq, North Korea, or Venezuela or Brazil. Where is our democracy? Where is our freedom of speech? And where are our rights to vote on something as critical as a cut in the police department of $850,000? That's my comment. Shame on all of you.
Thank you, ma'am. And point of clarification, it was $865,000 and they actually received a higher budget this year than they did the last fiscal year.
What, with their
Are there any other
raises
final
getting
comments from council regarding this
11% to
item?
3% or whatever it was?
Are there any other comments from council regarding this item? Councilmember Patron.
Yeah, I just wanted to tell City Manager Pyle that I'm grateful for his, seems like 24-hour service here to the city. It is 24-hour service, really. We get text to keep us informed of things going on in our ward that, you know, he always has everybody's safety and his employees at the forefront of his mind. And I just really appreciate you keeping us informed. And I would say that I implore you to continue doing that and giving us the opportunity to really weigh in and consider the ramifications of different votes that we take. It's really important. And, you know, we're not having to make rash decisions. I just really appreciate that. And also, I appreciate his dedication to the budget and to trying to continue to modernize our city and thinking outside of the box when it comes to different issues that prior administrations, my understanding, they weren't willing to entertain different ideas where since he's come from a different part of the country, kind of knows how to get things done and navigate new waters here, that I really appreciate having a fresh set of eyes and energy and a positive attitude towards all of these various different challenges facing every community. But Norman has always prided itself in wanting to not being afraid to face challenges, and I guess modernizing is the word I'm looking for. I'm thinking of an energy initiative and recycling initiative that Councilmember Bierman has been really excited about and wasn't able to get any groundwork or anybody to really listen to before, and he took that ball and just ran with it. And so thank you for that. And I am also wanted to echo what Stephen Tyler Holman had said about some of the budget challenges, especially in light of COVID. And while the police department is pretty much the only city department that didn't receive a cut, I know that those cuts are not easy. And he was able to save our employees and higher positions. And I just, they're desperately needed. And so he's smart with money. And so thank you, Mr. Pyle, and I look forward to continuing to work with you.
Thank you, council member. Are there any other final comments from council regarding this item?
I'm seeing none, Mayor.
All right, seeing none. Excuse me. The motion on the floor is to adopt the ordinance on second reading. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Carter,
Aye.
Councilmember Petrone,
Aye.
Councilmember Hall,
Aye.
Councilmember Wilson,
Yes.
Councilmember Scanlon,
Aye.
Councilmember Holman,
Yes.
Councilmember Scott,
Yes.
Mayor Clark.
Yes.
The ordinance is adopted upon second reading unanimously.
Now the motion on the floor is to adopt, or I'm sorry, I'll entertain a motion to adopt or reject the ordinance on final reading.
So moved.
Second.
Second.
The motion on the floor is to adopt the ordinance on final reading. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Carter,
Aye.
Councilmember Petrone,
Aye.
Councilmember Hall,
Aye.
Councilmember Wilson,
Yes.
Councilmember Scanlon,
Aye.
Councilmember Holman,
Yes.
Councilmember Scott,
Yes.
Mayor Clark.
Yes.
The ordinance is adopted upon final reading unanimously.
Thank you, Madam Clerk. On to item 4, consideration of ordinance 2021-3 upon first, second, and final reading. An ordinance of the City of Norman, Oklahoma, adding Article 11, COVID-19 pandemic to Chapter 10 of the Code of the City of Norman, Oklahoma, and adding sections to set forth findings of fact, definitions, mandating the use of face coverings with some exceptions, imposing capacity limitations through social distancing in bars and restaurants, setting forth a sunset provision, creating penalties for noncompliance, declaring an emergency, and providing for the severability thereof. I'll entertain a motion to adopt or reject the ordinance on first reading by title only.
So
moved.
moved.
Second.
Second.
The motion on the floor is to adopt the ordinance on first reading by title only. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Carter,
Aye.
one moment, Councilmember Petrone,
By title only, aye.
Councilmember Hall,
Aye.
Councilmember Wilson,
Yes.
Councilmember Scanlon,
No.
Councilmember Holman,
Yes.
Councilmember Scott,
Yes.
Mayor Clark.
Yes.
The ordinance is adopted upon first reading by title only. Voting against, Councilmember Scanlon.
Thank you. I'll entertain a motion to adopt or reject the ordinance on second reading, section by section.
So moved.
Second.
I'd like to recognize Catherine Walker, our city attorney, to make a presentation. We also have 2 guests with us today, Dr. Kate Cook from Norman Regional Health System and Dr. Gary Raskob from the OU College of Public Health.
Thank you. Let me get my presentation pulled up here real quick. Having technical difficulties.
We could turn it over to Dr. Kate Cook while you're getting that set up if you'd like.
That'd be fine. There we go. I keep getting kicked off, so I apologize.
You want to go ahead and move to Dr. Cook?
Ms. Walker, I leave that to you.
That's fine. I'll get this pulled
Okay.
up in a second, hopefully.
All right.
Okay.
Hi, thank you for having me. I'm Kate Cook. I'm a pediatric hospitalist.
And I just had some comments that I wanted to add to this discussion as we consider the masking ordinance. So COVID cases in Oklahoma have risen drastically over the past 2.5 weeks. I think most of us are aware of this, from an average of 130 new cases a day to a new record today of 858 cases in one day. Hospitalizations have also increased over the past 2 weeks from an average of 140 a day to 458 today. Deaths from COVID typically lag behind hospitalizations by 2 to 3 weeks. We're seeing an increase in younger people being infected, which currently bodes well for our decreased mortality numbers right now. But what we don't know yet is the young people who are infected currently, will they spread the disease to more vulnerable populations? And we'll see yet another increase in hospitalizations and deaths as these vulnerable populations become infected. Our neighbors in Texas are currently dealing with 5,000 to 8,000 new cases a day, and over 8,000 people are hospitalized. Hospitalizations in Texas have increased 4-fold compared to the last month, and ICUs in Houston have now exceeded their capacity. Austin and San Antonio predict to be 1 to 2 weeks away from exceeding capacity. I want to do whatever we can to safely prevent Oklahoma from being in a similar situation. Experts predict that in order to achieve herd immunity, we need to have at least 60% of the population immune, or to have antibodies present. So far, even in the hardest hit areas of New York City, antibody tests are positive for only 20% of the population. And the devastation and death toll that we saw in New York City multiplied by 3 is not an acceptable price to pay for herd immunity. We want to be able to safely reopen schools. We want the economy to recover. We want businesses to do well. We want football season. Masks and physical distancing and hand hygiene give us a fighting chance at all of that. We have had an opportunity to voluntarily make these decisions, but compliance has not been good enough to see the difference that we were hoping for as we begin to reopen the community. So I support the masking ordinance. I hope that we will all work together and move beyond the divisions that seem to be so prevalent in our society right now, and work for the common goal of getting us back on track. Thank you for having me.
Thank you, Dr. Cook. And I had heard today that Oklahoma City has opened up part of Integris campus in Portland specifically for COVID because other hospitals are filling up. Is that correct?
I'm not sure of all the details behind that. I did hear that the Deaconess campus had been dedicated to the state use as a COVID resource, and now that time may have expired, and that's why it's being opened up again for Integris use. I don't know if the other Integris campuses are at capacity.
Okay. And with Norman Regional, are we still in a good place at this time?
We are still in a good place. We have room to take care of patients and to care for the needs that our community has outside of COVID. I just want to make sure that we keep it that way.
Thank you. Dr. Raskob, do you have anything to contribute to that? I know you generously gave us your time last week as well as this week, but things have changed in 1 week. We've seen significantly higher numbers. On Saturday alone, we had 49 new cases here in Norman, and we're apparently duking it out with Broken Arrow and Edmonds to see who can have the most cases right now.
Yep. Thank you, Mayor. Thank you, Council, just for the opportunity to be with you. And as you consider this, I would like to concur with all of the comments of Dr. Cook. Very well articulated, concise, and accurate summary of the situation. I would just add that one of the things I specifically wanted to address are the risks and consequences, because I think that what we're trying to do is to work together as a community to mitigate the spread of the virus so that the various other activities can go forward, as mentioned, so that businesses can proceed and so on. And while to some people the risk of dying may not seem high, in fact, in subgroups of people who are vulnerable, it's quite high. And our goal, of course, is to work together as a community to prevent death and disability from this infection. This is not a benign condition. It's a very serious condition. Beyond the death, we don't know about the long-term consequences. So even to the young people who say, oh, it's okay, I might just get a flu-like syndrome for a couple of days. Well, we don't know what your lungs will be like in 20 years or 40 years from now with this condition either. Now is the time to act, because this will just continue to increase exponentially and very quickly until it gets to a serious situation. And as Dr. Cook mentioned, we don't want the healthcare system to be at the point where physicians and people are having to make rationing decisions about ICU resources and other things to keep people alive. That is a real possibility if no action is taken. The mask is the single most effective intervention we have. And I would ask that people step back now and say, this is a time to think about our community. The mask has nothing to do with a political statement or your views politically one way or the other. It is simply the health intervention we have to prevent spread of this virus. And the data that came out this week suggests that the distance of 6 feet, because of the way the virus is spread, the possibility of aerosols being created, maybe not the only thing that's important. And so the crucial thing is, again, the mask. And if we all wear a mask for each other, that's the goal. We'll prevent transmission. Now, do you need an ordinance to force it? Well, what we learn in public health about people's behavior is that many, many people take personal responsibility, but a lot of people don't. And in order for this to work, we all have to be doing this at a high rate of compliance and effectiveness. And I wouldn't view this as a council, I wouldn't view this differently to many other things that you have ordinance or rules on in order to encourage people to behave the right way with respect to this. But somebody's spouse or grandmother or sister, brother can die if we don't behave the right way with respect to COVID. And so I strongly support the ordinance you're considering and commend you for considering it, and appreciate the opportunity to talk with you.
Thank you, Dr. Razkab. It's also worth pointing out that the city of Stillwater had their first reading on this very similar ordinance last night. Fayetteville, Lawrence, Austin, many college towns in the area are considering this. And I do think that, I think every city should consider it, frankly. But with college towns, given the youthful nature of who's kind of getting it the most at this time, and us trying to have our students return in the fall, I think that's a common theme between college towns. And speaking of being a college town, we do have a letter from John Woods, the Executive Director of Government Affairs from the University of Oklahoma, that I wanted to read quickly. Members of council and mayor, the communication below is a statement from the University of Oklahoma concerning the consideration of a citywide masking policy to be considered this evening. The University of Oklahoma, in consultation with its chief COVID officer, Dr. Dale Bratzler, has instituted a masking policy for faculty, students, staff, visitors, and vendors across all 3 of its campuses. OU is doing all it can to foster a healthy environment for all university community members, and universal masking policy, paired with other safety precautions, is the best way to have in-person learning this fall. OU is pleased the city of Norman is considering a similar policy. Masking is shown to reduce the transmission of the virus by at least 85%. And together, the university and the city can work in cooperation to help slow the spread of COVID-19. By taking this simple, important step, we can lower the likelihood of increased hospitalizations, closing of campuses and businesses, and we can enjoy a healthier environment for all residents of Norman. We know how much our local economy depends on the students being here and all of the events that the university brings. I think no matter what happens tonight, pass or fail, we know life will be different in the fall. But we need to take a proactive step in protecting what we can. And just to lighten the mood a little bit, I did wear this shirt of why I will be voting yes today, because I would like to see a game day. So with that, Ms. Walker, are you ready to show your presentation?
I sure hope so. I'm logged on twice and I got kicked off of both logins. So hopefully that won't happen again.
Can our experts stick around for us to ask questions after, Mayor?
Sure.
Thank you.
Okay. So I'm just going to go through a little bit of background, which most of you are pretty familiar with, and then get right into the CDC recommendations and what this ordinance actually says. So we all know COVID-19 was first detected in China last winter. The WHO has characterized it as a pandemic, and the CDC has been tracking the spread of the virus and providing advice on how to prevent the spread and operate safely. And then, of course, you've heard from a couple of our local experts that we've been consulting with to share information and determine the best move for the city. Nationwide efforts to flatten the curve of the virus began in March with the goal of preserving hospital capacity and PPE. The city, in addition to the national effort, the city enacted its own efforts to flatten the curve in Norman. So proclamations were issued, 3 in March, 1 in April, that kind of got progressively more restrictive as the numbers went up, ultimately limiting gathering size and limiting activities to essential activities only. Then on April 27th, our numbers were looking really good. We thought we'd flattened the curve successfully, and we began a phased reopening that culminated in a return to normal activities on June 12th. So just to give you some of the data, as of April 30th, there were 213 total positive cases in Norman with 18 deaths. Between May 1st and June 15th, we were doing really well. We were averaging about 1 new case per day. We had 2 additional deaths during that 6-week period. In the last 22 days, we have seen an additional 327 cases of COVID-19. We're averaging now 15 per day almost, and 5 additional deaths. And most of these cases, almost 50%, are coming from the 18 to 35-year-old age range. So the primary source of spread, and I've put the CDC sources at the top of each slide, so you'll have those if you need them. It's person-to-person spread, so people within 6 feet of one another. They believe that this spreads through respiratory droplets that are produced when an infected person coughs, sneezes, or talks. It can be spread by people who are not showing symptoms, and that seems to be occurring particularly in those younger age groups, the 18 to 35-year-olds. So this is part of the concern that got us to this point. The CDC is recommending to prevent contracting COVID that you maintain good social distance, 6 feet between you and others outside of your household. You wash your hands often, or if you can't wash your hands with soap, use hand sanitizer. Hard to find these days, I know. That you routinely clean and disinfect frequently touched surfaces, and then you cover your mouth and nose with a cloth face covering when around others. This is directly from the CDC website about face coverings, and it talks about why it's important to wear one. And it says there that it helps prevent people who have COVID from spreading the virus to others. Wearing a face covering will help protect people around you, including those at a higher risk and people who frequently come into close contact with other people. These are people in businesses that never closed, at restaurants, in stores, and at the grocery store. Cloth face coverings are most likely to reduce the spread of COVID-19 when they're widely used by people in public settings. The spread can be reduced with cloth face coverings and other preventative measures like social distancing, frequent hand washing, and the cleaning and disinfecting that I talked about a minute ago. The CDC also has this guidance about why social distancing. This is a term that I thought just came along with COVID, but it's been around a lot longer than that in regards to pandemics. But it says COVID-19 spreads mainly among people who are in close contact, so within 6 feet for a prolonged period. Spread happens when an infected person coughs, sneezes, or talks. Droplets from their mouth or nose are launched into the air and land in the mouths or noses of people nearby. Kind of gross to think about. They can also be inhaled into the lungs, and recent studies indicate, as I said, that people who are infected but do not have symptoms likely play a pretty significant role in the spread of COVID-19. Since you can spread the virus before you even know you're sick, it's important to stay at least 6 feet away from others when possible, even if you or they don't have any symptoms. It's especially important for people who are at higher risk for severe illness. So in this ordinance, council talked about this last week. We heard from Dr. Raskob, we heard from Richie Split at the hospital, and talked about the numbers we were seeing in Norman. And so council asked that we draft an ordinance that dealt with masks in public, and also the issue of bars and public gatherings and those type of businesses. We're obviously all thinking about when the college students come back in August and how to keep the virus from spreading more rapidly and more frequently than it is now. So as a general rule in this ordinance, if you're interacting with others outside of your household, you should wear a face covering. It defines these places of public accommodation, public service areas, and public settings. Places of public accommodation are places offering items, goods or services for purchase or rent. So these are like retail businesses, spas, salons, entertainment venues, food service facilities, restaurants, bars, hotels, motels, professional offices and services, banks, repair facilities, motor vehicle dealerships, anywhere where you're allowing the public in and the public is coming in to get some good or service. A public service area is a place of public accommodation where the employees interact with the public in the normal course of business. And then a public setting is any public place where persons congregate, which is not a place of public accommodation, including offices, workplaces, houses of worship, childcare facilities, hospitals, health facilities, gymnasiums, adult and youth sports facilities, communal outdoor spaces, food trucks, other outdoor retail entities. So in all of these places, the general expectation under the ordinance is that you would be wearing a face covering if you're interacting with others in those places. There are exceptions, and most of these come from, practical considerations, but also from the CDC. They recognize that certain persons may not be able to wear a face covering. It could exacerbate a physical or mental health condition. It could lead to a medical emergency or introduce significant safety concerns. So those are situations where, you're interacting with someone who is deaf and relies on lip reading. They need to be able to see your face. If you're someone with a developmental disability, sensory integration concerns, some cognitive ability limitations, or other medical conditions that warrant accommodation. If you're engaged in an activity where the face covering is likely to become wet, that's not safe. That would be like when you're swimming. And individuals engaged in high intensity activities like running, youth sports, I've been asked about that. If wearing the mask causes difficulty breathing, they don't have to be worn. And then finally, if you work in a setting where the face covering may increase the risk of either a heat-related illness or cause safety concerns due to introduction of a hazard, you're exempted from the face covering requirement. The ordinance says if you meet one of the exemptions, you should consider using a face shield, but the face shield needs to wrap around the sides of your face and extend to below the chin. That's directly from the CDC as well. And consider options like carry out, curbside pickup, those type of options when available to help avoid coming into close contact with people outside of your household. It also exempts children under the age of 6, restaurant and bar patrons while eating and drinking. That's one of those common sense applications. Persons exercising in communal outdoor spaces, provided you continue to socially distance from other people outside of your household. Settings where a mask isn't feasible. If you're getting your teeth cleaned or some other medical treatment, it may not be feasible to wear a mask. Of course, inside your private car, in your private home, or in your hotel room, or inside your individual office space, you would not have to wear a mask. Places of public accommodation are required to post signage at the entrances to their facility that notifies the public that a mask is required. We're working on a uniform sign for all places of public accommodation, so everyone will have the same signage. And we'll be getting those out to the chamber and to other businesses as soon as that's finalized. The ordinance says that these facilities, places of public accommodation, will make masks available to people seeking to enter their establishments at no charge, provided the city makes them available to the businesses for distribution. We've had some contact with a willing donor, and we're working through that to see if we can't get an order of masks in pretty quickly and be able to distribute those to businesses. So when someone comes to the business and doesn't have a mask, you'll have a free mask to provide them. And then social distancing, particularly as it regards restaurants and bars, bar areas within restaurants. These are areas where you cannot wear a mask because you're eating and drinking. And so in restaurants, the ordinance says you have to arrange your seating to promote social distancing between groups of patrons. Many of our restaurants are already doing that. And then bars and bar areas within restaurants, you limit the capacity to the number of seats available. So no standing room only areas, and arrange the seats to promote social distancing between groups of patrons. And we have in here also thinking of primarily of the larger college crowds here, a closure requirement for bars and bar areas at 10 p.m. on weekdays and 11 p.m. on weekends. Most of the questions I've gotten are about how are we going to enforce this? And let me be clear, the goal is compliance. It's not to write tickets. And as we did through the proclamations, the focus will be on education. We want to create the general expectation that everyone will wear a mask when interacting with the public, but there isn't a specific penalty for not wearing a mask. If a business chooses to deny someone entry into the business because someone refuses to wear a mask and the police get called, we have existing ordinances that can address patrons' behavior and or the preference of the business. So for example, if you're denied entry because you refuse to wear a mask and you just get in your car and go home, no issue there. If you create a scene, if you're yelling and screaming, and some of these things we've seen go viral across the country, that's when the police may be called, and the business could sign a complaint. If they so chose to do so for disturbing the peace, they could trespass someone from the business. But those are the type of offenses that would probably come, and it would be based on the patron's behavior, not their failure to wear a mask. If the business doesn't post the required signs or doesn't follow the social distancing requirements, so it pertains to restaurants and bars, then it could be subject to a ticket. These, of course, we're going to do education first, warnings first, but once it's ultimately, if it results in a ticket, once it's ultimately adjudicated in municipal court, it could result in a fine of $50 to $500. This is pretty unusual for a city ordinance, but we have a sunset provision in this ordinance, and I know it's been a cause of concern for some, but there's a few ways the ordinance could end or expire. If the mayor rescinds the COVID-19 emergency declaration, the ordinance will automatically sunset. It wouldn't take further council action. If council takes action to repeal the ordinance, then the ordinance would automatically sunset. But if they do nothing, if nothing else changes, the ordinance automatically expires on November 30th. Just to give you some context for that date, the last OU football game is November 28th. The Thanksgiving break holiday is November 25th through the 29th for both Norman Public Schools and OU. So November 30th made some sense in terms of where it falls on the calendar for a lot of our activities. Finally, there's an emergency clause with this ordinance in Section 8. This will require a separate vote, and if it passes, the ordinance will be effective immediately upon passage instead of the standard 30 days after passage. Enforcement efforts, as I said, will begin gradually. We recognize it'll take some time to get signs up, to get masks in stock, and so we will focus on education first and work with businesses as we get those things in supply and out to the businesses. With that, I'd be happy to answer any questions.
Thank you, Ms. Walker. That was very informative and addressed many of the questions I have received today. I think some people were sharing misinformation about the penalties and whatnot. I did have a question, I guess it's kind of for Dr. Raskob. we had spoken in our last session about being very strategic in the restrictions that go into place, because we are trying to avoid a shutdown like we had the first time around when we flattened the curve the first time. And both Oklahoma County and Cleveland County have pointed to bars as one of the main sources for spread. So do you think that having that condition in there of closing is helpful?
Yes. Sure. Yeah.
Okay. All right. That was my first.
But during the opening times, the distancing is a crucial piece.
All right. Are there any other questions from council regarding Councilmember?
Okay. I've got a few different questions here. I get for Roscoe or Dr. Cook, either one. I don't. There's been some question about the sunset date. And so would it be fair to say that there is a scientific reason for why we would want to give enough time? In other words, why wouldn't we just reassess next week? Are the numbers that are coming in today infections from today, or are they infections from the past? And if so, what would be the appropriate amount of time? Would we need, 1 week enough, or assess it every week, or is there a good reason to believe in science that we would need more time? Hence November 30th as a sunset date. So I guess Dr. Raskoff or
Okay.
Dr. Cook, I don't care.
Okay.
Whichever one of you wants to take it.
So the general incubation period of the virus is 2 weeks, right? So it can take that long for symptoms and infections to manifest. So, typically things lag. And so we know that assessing things in an ongoing basis, we know how to link timing of cases to likelihood when people were infected, and then we know what to watch for subsequent deaths and mortality, right? But the point I would just make about this is that this virus there's no time frame on which it's not going to be here anymore. It's here now in our community, and the only way it really peters out in terms of what it's doing is either when we get a vaccine and we vaccinate a wide number of people, or when we achieve the herd immunity just normally through a lot of people being infected. But it's going to be around and with us in the community for years. This question is just how fast is it spreading between people?
Okay. So do you feel like a September 30th date is an appropriate time to revisit this? Is that enough? Is that enough window of time that we would be able to get some understanding of whether or not the mask ordinance is helping with numbers and spread in the community?
It's hard to say. We'll just watch what things show, but you saw that when the shelter orders went in place, and we saw the data from Cleveland County and Norman City on number of cases and so on, that took effect pretty quickly, right? So I think you'll have a good idea of what you're doing, but the question will be at September 30th, what is the reason to remove it?
Sure. Okay.
I would also like to add that the idea of extending this into flu season, I think, would be very beneficial. I think as we see other sources of infection increase, it's going to be very hard to tell who has what. And I think masks will help prevent flu as well. So I think, extending it further into the fall is a good idea.
Okay. So I've also seen the question asked several times, if masks work, why not just reopen fully? There are other parts of this ordinance that discuss the, social distancing restrictions and what have you. So should the community believe that if once they, if we have a high number of did it cut out? Did it cut out?
Yes.
Were
lost
y'all
audio.
able to hear that?
No,
It was cutting out.
Okay, am I back?
Yes,
Am I back?
you're back.
Okay. Sorry about that. Okay, so there are several members of the community that have said if masks work, if the compliance is, if we get a lot of people wearing them and it's successful, why not just reopen fully? Why wouldn't we just not implement other social distancing restrictions? And, why would we want to have several prongs to this? Could you speak to how your response to that?
I would say it's an issue of layers of protection, that just like you don't throw your toddler into the pool with just a puddle jumper, you need a fence, you need an adult. So masks are helpful. They aren't the 100% guarantee that you're not going to get sick. And so they're the best reasonable, minimally, costly thing to do to help prevent infection, but still you need to keep your distance. They're not going to prevent 100% of infections with just cloth masks or even N95 masks.
Yeah. Cool. That's a good analogy.
I would just point out too that the only other restriction in the ordinance has to do with restaurants and bars, and that's an area where you don't have to wear a mask because you can't while you're eating and drinking. So those are areas where it's otherwise accepted from the mask requirement.
Oh, I did have a question, Ms. Walker, about that on the hours on that, but I'll ask you in just a moment. I want to stick with them, tick off some of these comments that I've gotten. Okay, so members of the community asked if are positive cases double counted if someone feels like they are feeling better, like they've tested positive, they get sick, and then they're feeling better, so they a few days later go and test again. Does that count as another positive in our total case counts of positive, or are they required to wait 14 days before they test again? How do we compile those numbers?
Our cases really are just counting the one time, right? They're not, unless the person comes back many weeks or months later, I guess, after having been proven to be negative or so on, but we don't have those. So for practical purposes, you can say we're counting the first instance of infection, and a positive test later in a person known to be infected isn't adding to the cases.
Thank you. That's what I needed to understand. Okay, and then what does recovered mean for purposes of the CDC numbers? If someone is no longer negative, or does that mean they're fully back to themselves?
I don't work for the health department, but my impression is that recovered means they are outside of their quarantine period. So for someone who tests positive, they have to isolate for at least 10 days, plus 3 days without fever and improving symptoms. So it would mean those people who are no longer requiring isolation. That doesn't mean they don't have any other symptoms, or they may not have lasting effects from the illness. Lots of people don't recover their sense of smell or taste for a while. So I think those would still be counted within recovery, but that's not to say there's no lasting effects.
Yeah, Kate, and I would just add, I think recovered is actually an unfortunate term. I think what we actually say is that they survived, but recovered will be highly variable for individuals and will vary in the symptoms. So if the person was very sick and went on a ventilator and happened to live, those patients won't recover their full lung function for a year, at least. And I think there's many stories that you can read and other things about testimonies of patients who got COVID who are struggling many weeks and months later with symptoms of a variety of symptoms. So recovered is not really a meaningful term in the way it's being used right now.
I just received input from another physician who's watching, and she reports that recovered is 2 weeks after the health department considers them recovered 2 weeks after their test if they have not passed away.
Thank you. So we're not really taking into account the latitude of positive test versus dead. That's really all we're judging by. Okay. So why is it taking so long between the lag time of someone passing away before their number is added to the death count? It seems like, you know, they'll say, well, they died sometime in the last 3 weeks. Like, what's taking so long?
No, I can't speak to that. I think we'd have to ask the health department about how that tabulation works and what those delays are. If they're there, I don't, you know.
Thank you. My dog keeps snoring over here, so I keep trying to mute it so y'all don't have to listen to him snore. And let me see if there's any more of these. MPS. I know, Mr. Ruskov, I think that you sat on the task force for MPS, and I'm wondering if they're paying attention to the case counts and mask ordinance proposals and all of that type of thing as they continue to weigh reopening plan. If you could speak to any, if they're going to revisit that.
Both Dr. Cook and I are on that task force, and we also participate on a health subcommittee, which looks at these issues in great detail and are considering all of these things as to how they would play with respect to, you know, school operations and so on.
And Dr. Cook, I was really floored by the only 20% antibodies in New York City. And so I have seen this herd immunity thrown about quite a bit. And so I'm wondering, Dr. Raskoff spoke last week about there was only 4%, around 4%, I believe he said, Oklahoma positive antibody tests. This is off memory, so I could have gotten that number wrong. I wanted to see if there was an update on what that percentage rate looked like for Norman. And also, this is kind of a two-pronged question. If someone tests positive for antibodies, does that go into the positive case count for sick people? And the reverse as well, if someone tests positive, does that mean that it could just be that they have the antibodies and or that they're just positive for the common cold or another coronavirus?
So as far as the antibodies, those numbers are not counted in our Oklahoma case numbers. So when you see number of new cases per day, that does not include antibody tests. So that's just PCR detecting active infection. When Norman Regional started doing antibody testing, our positive rate was around 2%. So I don't have the update of where we are now as it's extended further into the community, and certainly not, you know, if we're already seeing any effects of the rises in the last, you know, week and a half to 2 weeks. But I would say if New York is only at 20%, we're far, far away from herd immunity here, which, you know, I would hate to think of what kind of mortality would be required for us to reach herd immunity. As far as, I'm sorry, I forgot the first part of your question.
It was about whether or not somebody, say they take a PCR test, but they're not sick and it comes back positive. Could that be that it's picking up an antibody for it or a positive result for a different coronavirus?
No, so the PCR detects the RNA from COVID-19, and those are very specific. Some people can be asymptomatic carriers, which means that they have the infection but have not developed signs or symptoms, but unfortunately they can still transmit the infection to other people. So that's one of the reasons that masking is so important. And also that even people who go on to develop symptoms, they're most infectious to other people the day before and the day of the onset of their symptoms. So by the time you realize that, oh, this is more than just, you know, allergies, you may have already infected people.
And it can't be that they're testing positive for an antibody. It's
Right.
active
The
COVID.
PCR and the antibodies are different tests. And that same physician who's watching, thank you, has just told me that the positive antibody rate for the state is 3.3% as of last week.
Okay, thank you. If you can, the physician that's watching, I wonder if he or she could speak to via text with Dr. Cook, what some of the long-term, and we'll give you a chance to answer and circle back, but what some of the long-term complications are that we're seeing. I was listening to one of the shows last night, the news that was saying that even with asymptomatic people, we're seeing that in x-rays of their lungs, I may not be using the right word, but that there was still scar tissue that was showing up present. And so they were saying, you know, that it could very well be that these people have long-term complications of having had COVID, even though they were close, asymptomatic or close there too. So I'm wondering if we've seen some things that could share. And they were also speaking to ECMO machines and a shortage of those around the country. But so maybe if he or she can chime in on that, that would be interesting. But
I will say that there are definitely anecdotal stories of folks who have presented for other reasons. And certainly, you know, here, even in Norman, that once we started universal screening in hospitals for women in labor or preoperative screening, or even people going to camps, that yes, we did pick up some, you know, people who are positive who didn't have symptoms, or if imaging was done, like for looking at for appendicitis, they happened to see the bases of their lungs and they were affected. So even though people may not be complaining of respiratory symptoms, they have had changes in their lungs.
oh, that's scary. Okay. And then I think the last, before I ask about the hours on the bars, are we backlogged on tests? If anybody that wants a test, get a test, are we to that point that
I don't have the latest update from the health department. I know at one of our meetings last week, they were scheduling appointments about a week out. So that was, you know, not ideal for what we want people to be able to receive. Currently, Norman Regional Lab is doing fine on keeping up with the tests that they're getting. But as far as, you know, a test that is of no cost, we're having some difficulty there.
okay, the numbers that were 858 today, I lied, I'm asking another question. The number 858 today, was that cumulative over the weekend, or did we get data over the weekend as well?
We got data over the weekend as well. Those were the numbers reported for today.
Okay. Thank you so much to both of you. Ms. Walker, I do have a question on these, and it may be that the doctors would want to chime in here as well, but it feels like that with the bars and restaurants closing at 10 and 11, that they're some of the hardest hit with economically anyway from the closing. So I'm wondering what the scientific reason would be for that, and if that's something that the council would want to consider, maybe revisiting, maybe pushing that back a little bit, or if at least thinking about it before the final vote tonight and considering an amendment to it, or at least hearing what a scientific reason would be for those. Is it an arbitrary hour that we chose, or is it something that you can explain further?
Sure. I think what we were asked to do was try and get creative on ways to address the bar issue, both in traditional bars, which we don't have that many, but in bars that operate under a restaurant license. And there's quite a few of those, and there's some in Campus Corner. And so the idea with the closure at an earlier hour is really thinking of the college crowds when they come back to school. If you've been down to Campus Corner during the semester past 10 o'clock on any given night, there are lines out the door at most places. And that's really when their night's just beginning. So I think the idea was just to reduce the impact of those large crowds and try to avoid those situations.
Was there a recent super spreader event with respect to lines outside of a bar in a city here recently?
We haven't had one that I know of in Norman. I know that the health department was telling us that in Oklahoma City, especially, they're seeing that kind of situation happen where they're identifying the source of the spread as being restaurants and bars specifically. Here, we haven't had that yet. Probably with the school being out of session, maybe that's made that less likely so far. But that has been the case in Oklahoma City and Bricktown. I know.
Can I jump in and clarify that we very well could have had it, but our contact tracing is so blown right now that we are unable to detect super spreader events.
Okay, that's for the moment on questions. That's all I have, and I appreciate all your time.
Okay, we have several hands up, Mayor. Councilmember Holman.
Okay, thank you. Catherine, our ordinance said, or did say 2 years old, correct?
The first draft I sent out to council last week said 2, but we've changed that to 6 years old. The CDC.
I heard 5 yesterday, so.
Oh, no.
Okay.
Yeah, the CDC says 2 and under shouldn't wear them, but we had a lot of concerns about that. And it's just a practical issue of trying to, convince a toddler to wear a mask for a long period of time. So that was changed to 6 based on council feedback.
Okay, thank you. And the enforcement part, so you mentioned how the city is going to provide a sign and we're going to provide masks as well. Is that what I understood?
We're trying to. We've got some indication of a donation that would provide the masks. What the ordinance says is that the businesses will provide masks for free if we are able to provide them to the businesses. Otherwise, they don't have to provide those at no cost to the patrons who don't come in with one.
Okay, so just to be clear for everybody watching, if the city is able to provide the businesses with masks, then the masks would be asked to give those out to customers. But if the city cannot, then we're not requiring businesses to go out and buy masks so that they can give them out for free. Is that right?
Correct. They're welcome to provide them. They're welcome to sell them, but nothing in the ordinance requires that.
That would have been somewhat of a concern of mine too, is that it's been sometimes difficult to find them. I think it's gotten a lot better recently, but we had a period of time where it was difficult, and just in my own business, it sometimes can be a little tricky. But I just want to make sure that businesses aren't going to be penalized if they couldn't find them, they're not available, something like that. So just to be clear on that, so I do appreciate that. And then I talked with Rick Knighton for a while on the phone yesterday about a few things. So I had people ask about the ADA guidelines, about how specific it was and where it is actually specified at for them to see. They wanted to make sure there were certain respiratory disabilities or medical issues that were addressed in that. So I don't know if you might touch on that, the ADA part.
Yeah, and that's definitely been a concern all along. I don't think we want businesses, telling their customers, well, you have to give me some documentation of this ADA concern. We can't get into that kind of thing. But we tried to make the language broad enough. And this came from the CDC, and then based on council member feedback, I added some language to make it even more clear. But persons or situations identified by the CDC where the wearing of a cloth face covering may exacerbate a physical or mental health condition, lead to a medical emergency, or introduce significant safety concerns. And it goes through all kinds of different sort of issues that these masks may present. But I think that lead-in language, including but not limited to, that leaves it broad enough. If someone has a respiratory issue that's not explicitly covered in here, I think that's a fine basis for an exception in that case. We don't want to make people have more trouble or more medical issues because they have to wear a mask, as we have to try and consider all of those situations, which means the language ends up being pretty general.
Would it address an issue where someone is physically disabled and in a way that they would be unable to remove the mask themselves? So they could just be any age, 40 years old, but they are physically disabled to the point they wouldn't be able to remove the mask from their face. I've had some people ask, if they threw up in the mask and they weren't able to remove it, is that an issue? Does it address that type of thing?
Yeah, in C1, 2, this is under the exceptions, and it has the general language from the CDC, but this is where I added or other disability or medical condition warranting accommodation. And so that's where I think a lot of these situations that maybe we don't anticipate right offhand would be covered to give someone some flexibility if they have those kind of concerns.
And
there had also, Stephen, can I jump in real
Please,
quick?
yeah.
There had also been discussion about creating some sort of sticker or button that people with these conditions could wear, because we don't want them getting harassed for a viable medical condition. So that's something we could look into. I don't know who would distribute those, but that was something that was discussed at some meeting I've been in.
Okay, thank you. You briefly kind of touched on it, Catherine, but I've had people ask, am I going to be stopped and asked, like, am I going to have to present papers that say that I have an issue, I'm exempt from this or anything like that? Are people going to have to carry anything on them that, proves what, their health status?
No, I wouldn't advise any business to ask those kind of questions of a patron.
And the city's not be asking for that.
No.
And I've had people ask about the school system. Norman Public Schools is what we think of, but there are, Little Axes in Norman city limits and CCS and All Saints. And so multiple people have asked if this applies to the school systems. Under my understanding is no, that those are not governed by the city of Norman, so that it would not apply to their facilities. Is that correct?
NPS and Little Axe and OU are all local subdivisions of the state. And so the position we've taken all along is that we want to work cooperatively with them, but we can't force them to do anything. Other entities could be covered by this if they meet the definition of place of public accommodation or public setting. It does not explicitly spell out educational facilities. And that's likely a decision each school is going to have to make based on the feedback from their enrolled parents of enrolled students.
Okay, so it'd be good for people to contact their school board member if they feel strongly about that issue. Okay. And the kind of on the how long do businesses have to comply? Like we said, we're talking about providing the sign, potentially providing masks. So we're talking about an emergency clause. So is it tomorrow morning? Is it next week? You mentioned gradual enforcement. Can you describe exactly what that is?
I think the hope is members of the public are going to be wearing masks tomorrow. But we're not going to be trying to enforce the ordinance if a business doesn't have a sign, or if we get a call and someone's refusing to wear a mask, refusing to leave a store, but they didn't know about the ordinance. We're going to give time for education, however long it takes to get masks in to be able to hand out. We definitely want to be able to provide those. And then as we finalize the signage, I know there's been some work with the chamber to develop a sign. Those will be handed out. So it's going to take some time. It's not going to take the full 30 days, but that would normally be in play for a normal ordinance without an emergency clause. But over the next week or so, I think we'll start ramping up education efforts and start looking at enforcement after a week or so.
Okay. And this question is actually from a retired Norman police officer that lives in Ward 7. He wanted me to ask this question. Rick did clarify it for me yesterday, but I do want to make sure it's clarified on the record. So the question was, how will this be enforced? Will Norman police officers make on-view arrests? Also, I see the proposed ordinance lists persons refusing to wear a face covering into a place of public accommodation or public setting as defined herein shall be subject to prosecution for criminal trespass, disturbing the peace, interference with official process, or similar offenses as circumstances warrant. Would an alleged violator face charges under all three ordinances and potentially others as applicable? And if this ordinance is enforced by the Norman Police Department, what will the policy be on enforcement? A couple questions there.
Okay. The last part cut out just a little bit, but
Sure.
I think I talked to Rick. I was aware of this question. It would depend on the situation. I would think it's very unlikely anyone would be written a ticket for more than one violation, although it could be a disturbing the peace situation where the business owner says, I don't want them coming on my property again. So you could see a trespass with that. Typically in these situations, and these are ordinances we've had for a long time, these are often citizen signed complaints. Because usually by the time the officer gets there, whatever situation led to the altercation or the event has ended, maybe the person's gone, or maybe they've just calmed down. And so usually we're relying on citizens to sign the complaint in those situations. But I think it would be a very rare occasion. I'm trying to think of if I've ever seen that even where it's been more than one of these types of charge, certainly not all three.
And the Norman police are not going to be, the way I understood it, the way I understood Rick's response was that Norman police are not going to be driving around looking for people not wearing a mask.
No.
They're not going to cite people just for not wearing a mask. It would have to be a complaint based from someone else. Is that how I understand it?
Yes, and even in that case, it wouldn't be just because they weren't wearing a mask. It would be some other behavior that falls under one of these other ordinances. So they're not going to be going around proactively, pulling over and saying, where's your mask, or going to a business and standing at the doorway and trying to enforce it in that way. Our goal is compliance and education. I think Dr. Raskob said last week, if you can get.
Do we lose Catherine?
I believe so, temporarily.
Okay.
I think she's going to say if we can get even 60% compliance, it will make a difference.
Right.
I've heard that line a couple times.
But that is a question I've received quite a lot is, are the police going to be proactively enforcing this, writing tickets to people just for not wearing a mask? But the way I understand it is if there's a complaint filed, in one example, a business asks you to put on a mask, you refuse to, and you refuse to leave their business, the police would respond and the police would ask you to leave. And if you refuse, the police could trespass you or cite you for disturbing the peace. That's the way I understood, or the way I do understand the enforcement side of this.
That's the way I understand it. And the trespassing or disturbing the peace is generally signed by somebody else. That's a third-party complaint. The ordinance does not seem to be there's no violation attached to this ordinance where we would write them for not wearing a mask. We're writing them for those other violations, and they are generally signed complaints.
So someone would have to go pretty far to end up getting a citation for this.
It would seem so.
Okay. I appreciate that, Chief.
That was Chief, just a moment, council member. That was Chief Foster, for those of you that may not know who was speaking.
Thank you. Okay, I do have a couple more. Make sure I got my notes there. A couple of medical, maybe related. So I did have a question of if the health department, the county health department, would be involved in enforcement against businesses. If businesses refuse to comply, would it be considered some sort of health code violation from the health department standpoint? I had been asked if that would be an issue businesses would be dealing with, if there would be a surprise inspection from the county health department or some sort of penalty or fine from them.
City Attorney Walker is trying to log back on, but we talked about this in our emergency operation meeting earlier in the week, and under state statute, the health department is not allowed to enforce any local city ordinances. So no, they would not be doing that.
Okay, thank you very much. I appreciate that. That definitely clarifies that question. And then I think maybe for Dr. Raskob or Dr. Cook. So I had just a couple questions I received about and I had mentioned it last week a little bit about mask use and one, their disposal, whether they're considered a biohazard, should people use caution when picking them up off the ground and disposing of them? And one of the questions I'd received too was, how often should people change the mask throughout the day? Bailey, the question was kind of, how can one think that a mask with a day's worth of soilage and repetitive self-contamination, self-inoculation, and re-aerolization, that's all in capital, that people will not also acquire viral exposure? That might be a Dr. Raskob question.
I can hop in while he's in a meeting.
Yeah, go ahead.
But I think a discarded mask would be similar to a Kleenex, that it's got your respiratory secretions on it. You should put it in the trash. If you have to pick it up from someone else, you should wash your hands afterwards. It's not like a dirty needle or bloodborne pathogens that have to have special disposal. And as far as re-aerosolizing your own infectious secretions, so the idea with the mask is to block you from spreading your respiratory droplets out into the world. And so if it's coming from you, you're just exposing yourself to what you already have. So you're not re-infecting yourself with anything. I think the recommendation for disposable surgical masks, like these paper masks, is when they're moist, you should change them because they're less protective. And so I would feel like that's probably also true with cloth masks if you are able to change them, and you should wash them daily as well.
Okay, thank you. And would either of you be able to speak about just from a working in a hospital type setting, what is the average cost of a hospital admittance for COVID-19? Insurance or no insurance? Do we have any idea of how long is the stay that we're seeing usually if someone does get sick enough to have to be admitted? And any kind of ballpark what the cost of that hospital stay is to the average person?
I will call on any of my fellow clinical physicians who are watching to try to answer that. I had read somewhere that an average hospital stay that includes ICU would be longer than 12 days. And so it would just depend on, what level of care is required. So, once someone is sick enough to be in the ICU, it is very likely that it will be, a hugely expensive hospital stay. But even a short stay, for some oxygen for a couple of days is a huge expense. And so I think a lot of times we're focused on mortality numbers, and well, if, the most people are recovering and doing fine, there's still a lot of morbidity. So health impacts from this disease and financial impacts from a hospitalization or even emergency visit from this illness. So it's important to keep all of that in mind as well.
Thank you. That's kind of been my thoughts about it too, is that a lot of younger folks under 40 like myself kind of had the opinion that, well, I'm not likely to die from this, so it's not that big of a deal. It's like the flu, so on and on. But outside of just being, we could have it and not get very sick and transmit it, pass it on to others that could be more harmfully affected by it. I've really tried to talk to people about how Oklahoma is one of the states that has the highest uninsured rates. Thanks to voters last Tuesday, that's going to change a little bit. But right now, we do have one of the highest uninsured rates in the entire United States. And most young people in Oklahoma under 40 do not have health insurance. Thankful to my job, I just got health insurance for the first time 3 weeks ago since I was in high school. I graduated high school in 2004. So I haven't had health insurance in over 15 years. And I knew that although if I got COVID, I might not die from it, I was almost guaranteed to not die from it. I absolutely could not afford the hospital bill that would accompany it at all. I could not afford just one night of being admitted to Norman Regional Hospital. I do know how much that costs because it's still in my credit from the last time I had to do it without insurance. So that has been the biggest concern of mine, and the biggest concern for me in a college town like this, where we have so many young people, that we have kind of this immortality thing that we are not going to die from this, but we don't think about the immense monetary cost of having to be treated for it. So I did just want to clarify that this is more than just death rate. It can ruin you financially as well. Well,
I just add to what Kate said, a couple things. We know from the literature so far that in people who get very sick, go in ICU and survive COVID, some of those people can be on ventilator for 2 and 3 weeks. And so the bills could be profound, okay? Hundreds of thousands. So then the other point I would make is, if it's an uninsured person who goes to the emergency department and is sick, they will get cared for under our laws, right?
Right.
But the hospital has to find a way to recoup the costs. And so we know what happens with cost shifting. And so it's estimated that of those of us who have private insurance through our employers, about 20% of our premium is due to the cost shifting for uncompensated care that the hospitals will negotiate into their contracts with the third-party insurers. So again, preventing cases, your point is really well taken and is good to say, to young people, you may be putting financial burden on many other people, including, others, regarding health insurance, whether they are insured or not.
My online resource is telling me that the average COVID hospitalization is $30,000, which,
wow,
has a huge range depending on your level of care.
Yeah. That's comparable. I mean, it's considerably more than my student loan debt. So anyway, but even with health insurance, deductibles can be significant too. And a lot of people, from last statistic I heard, most Americans, or at least half Americans, don't have $500 in their bank account in case of an emergency. So I know most co-pays for any insurance is more than that. So anyway, that's kind of been my thoughts about that part. The bar issue, a couple of thoughts about that, just based on my experience working in a bar for a number of years. To me, I kind of feel that limiting the time, most of our bar only places, which is mentioned, we don't really have very many bar only places in Norman. I think 5 or 6. And they usually open at 4 p.m. and they're usually open from 4 until 2 a.m. And so my concern about limiting the hours is that we might just get a whole lot more people come to the bar between 4 and 10 p.m. And I think letting them keep their regular hours would help spread out the attendance, in my opinion. And I think our bar only places, based on the feedback I've heard from some of them, they are not getting the customers to even come close to the capacity reduction limits. And I think some of them would prefer to work with a reduced capacity after 10 even than have to close. So I would prefer us not have to close anything else and really push and encourage people to wear masks. I know, like was mentioned, the bars have been hit really hard by this, and there's not very many of them. And I do understand the concerns about some other bar/restaurants on Campus Corner. I think we could address that by reducing the capacity, maybe after 10 or just altogether, to address some of those outdoor patio situations that we've all been getting pictures of, things like that. But that's kind of my thoughts on that after I've heard from a few bar owners and some bartenders that are kind of struggling right now. And that time period between 10 p.m. and 1 a.m. for some really popular bars is a really big deal. Some others, they may only get 5 or 10 people that come in during that time. They'll sit at the bar and have a beer or something. So I would just want us all to take that into consideration before we make a final decision. And then
Can I comment on that, Councilmember Holman, before you go to your next point? So you mentioned just wear masks. They're not required to wear masks in bars, which is part of the problem. And then you mentioned reduced capacity. We already have reduced capacity with this ordinance. There's no standing room by the bars and tables have to be 6 feet apart. So, I mean, I understand your concern, and I certainly don't want to hurt a business that's already been hurt throughout this. And we do have an economic recovery package that will be on the August 25th bond. And perhaps we could allot a specific amount for these industries that we are impacting in the interest of public health. I mean, and if they have their masks off, even if they're social distance and indoors for 4 hours at a bar, I feel like, as we've seen around the world, the chances to spread go up. It's just not a safe environment. I mean, I get it, but I'm thinking big picture and trying to keep the rest of the city from shutting down at this point. And we've been told we have to be strategic and surgical, and this is our first attempt at doing that.
I absolutely understand what you're saying, Mayor Clark. I just think that by limiting the time period they can be open, it just means we're encouraging more people to go there during that time, instead of allowing a longer period of time where people could kind of spread out. And so I think the bar, you know, they were only going to allow 10 people in and could socially distance. I understand they can't wear masks, but I don't know if there's a whole lot of appetite to force people to close their business again. So that's just kind of what I've been hearing. That's kind of my opinion on it, but I do definitely understand where you're coming from.
I don't have an appetite to close businesses again.
Yeah,
You know?
Yeah, I understand.
And then the policing that comes from it, are all the bars going to say, oh my gosh, I need help, we're at capacity, and then we put a burden on our police department? I mean, that's another thing that we have to consider. So I get it. Sounds like we're encouraging day drinking, but I don't think that's what our goal is, but I understand. And here's a point too. If the concern is the students, which I don't think it is, I think, you know, I have a life, I'm 37. I like to go out occasionally, but we can adjust this ordinance at any time, if that part specifically. So that's, I think, worth pointing out. For example, if OU does close and the young people leave, and we don't have so much of a capacity issue overall because 20,000 young people have left, perhaps that's the part we remove and leave the masks in place.
Well, I'd maybe be open for not making the bars close, reducing their capacity, and revisiting it in a month if we need to adjust it because the bars are a problem. That may be a compromise we could think about. But is Catherine back on by chance?
Yes.
Okay, I just wanted to get one final clarification. That was a lot of people refer to this as a mask ordinance, but I want to be clear that it's actually not a mask ordinance, it's a facial covering ordinance. So it doesn't necessarily mean you have to wear a mask like what we see. Could you maybe touch on that a little bit and what that kind of covers?
Sure, and I apologize, we're having Wi-Fi problems, so I'm having to connect by phone, but face covering is what the ordinance discusses. It does not say mask, so it's face coverings, and those are defined consistent with the CDC recommendations. It's a covering that fully covers a person's nose and mouth, including but not limited to cloth face masks, towels, scarves, bandanas, as recommended by the CDC. And then it just says that it should be worn so that it fits snugly on a person's face, but allows the person to breathe easily, and is worn consistent with the guidance from the CDC. So it can be anything, cloth that covers your nose and your mouth.
Okay, that is all the questions I have right now. So thank you very much. I appreciate the detailed responses from everybody.
Okay, we have a few more council members, and we still have an audience group that would like to participate as well. Councilmember Bierman.
So my apologies if I feel like this question has been asked maybe in a couple different ways, but not exactly this way. We've seen some recent reporting that antibodies from a COVID infection may or may not last as long as previously thought. it may only last several weeks in people with mild cases. Can either of you speak to that and whether or not we can rely on any long-term benefit or protection from antibodies or from herd immunity?
So in some people, the antibodies, probably in about 20% of people from a recent study, they'll be non-detectable at 2 to 3 months. That doesn't mean they don't have immunity. There's memory, maybe, we don't know, but we just don't know. There's many questions regarding immunity to COVID and recurrent exposure later in immunity that we just don't know. And those studies are being done. But the two most important things are, just because you have protected antibodies doesn't mean you are safe from being infected in the future, and you shouldn't put yourself at knowingly at risk or take risks you otherwise wouldn't take if you didn't know about those antibodies. And then secondly, a negative antibody test doesn't mean you have been infected with COVID.
Thank you for that. I appreciate it. And then is there any scientific consensus that short or long-term mask wearing has an impact on a body's oxygen levels?
We've been wearing masks for decades and decades in the medical community, and we're all doing just fine. It does not impact your ability to breathe. It doesn't make you retain too much carbon dioxide. They're safe.
Just wanted to make sure to kind of get that out there publicly. My mother's an MD. She spent many a 24-hour rotation with N95 masks and deep ridges around her face from wearing them for hours and hours at a time. But that was something that I heard in a number of the emails and calls that came to me today. And then just, I think we've pretty much already talked about this, but at what percentage is considered herd immunity? And for all those who joined us late on this call, what percentage are we at for what we believe antibodies have been found in percentage of the Norman population?
Well, go ahead, Kate. If you
for what I had been looking up today, because I've been working on things about COVID all the time lately, 60% is required for herd immunity, and currently the state of Oklahoma has 3.3% positive antibodies.
So even despite having however many hundreds of deaths we have and thousands of cases, we are nowhere near herd immunity.
And the hardest hit areas of New York City have 20% antibodies positive.
And I would say 60 is the minimum. It could be 70 to 80. It depends on the number we call R naught and how it's spreading in the community.
And then just one last thing, you know, I have a very close friend in Arizona. He is a marathon runner. He runs a marathon every single weekend. That's his joy. He's also a Broadway actor and Broadway singer. And he tested positive on March 31st. He got his second negative test on May 1st, and he is still at only 40% lung capacity. Getting up off the couch, walking up a flight of stairs, wins him to the point where he feels like he has run a marathon. Is that consistent with some of the, I know it's hard to say that we've seen long-term effects from coronavirus because it hasn't really been in the United States with much prevalence, but for only a few months. But is this consistent with some of the long-term effects you are seeing both in the cases that you've reviewed personally and some of the research that's come out?
Yes, I think, you know, our focus on mortality leaves out that whole picture that otherwise healthy people can be very ill and long-term consequences from an infection. So deaths are not the only important thing to consider in this illness.
And that actually led to one last question. Is it considered a positive public health policy to encourage people who might be medically vulnerable but still active, normal, participatory residents in their community to simply stay home?
I think that brings up the point of folks that are resistant to the masking policy, saying that's violating their rights and their liberties, when we're considering a large percentage of the population who does have other medical conditions that now we're saying that they can't come out of the house because we don't want to protect the public health by wearing masks. So while yes, if you are in a vulnerable population, you need to take extra precautions, but I don't think it's fair to say that nobody else should take precautions because they're not in a vulnerable situation.
Thank you. I appreciate that. That's all my questions. Thanks.
Councilmember Wilson.
Ms. Walker, I have a couple of questions about legal questions. So what authority do we as a council have to require masks? And then what is the constitutional considerations with us requiring masks? That's my first question. I have another one.
Okay, so a city's core function is to protect the public health, safety, and welfare of its citizenry. And so there's nothing in state law or in constitutional law that I would interpret as saying we can't impose a mask requirement as long as it's related to an important governmental purpose. Here, protecting the public health. Here, we're following the CDC guidelines and how we're doing it and giving reasonable accommodations for those who can't. And so I think that what we're doing here is both constitutional and reasonable.
Okay, thank you. I appreciate that. The other question, and it's also a legal one, in the state of Oklahoma, I believe there's some sort of we have an open carry law, and there's a concern about wearing masks and being able to openly carry a weapon. So can you speak to that?
Sure. There's a statute that talks about when you cannot wear a mask, and that's during the commission of a felony or with an intent to commit a crime or hide your identity. And I don't have that exact language pulled up, I apologize, but this is certainly not the case in our ordinance. We are not asking anyone to violate that ordinance, that state law. That statute pertains specifically to criminals or people in the commission of a crime.
So what I'm hearing you say then is that the open carry statute with the state of Oklahoma doesn't have anything in it, as long as you're not committing a crime, an otherwise criminal offense, that there's nothing in there that says you can't wear a mask and have a gun on your side?
No, not to my knowledge. Just trying to pull up that statute real quick, but no, the statute's very specific that it's prohibited when you're in the process of committing a crime or you're intending to conceal your identity or something along those lines.
So you can open carry legally in the state of Oklahoma and protect the community by wearing a mask. It sounds like what I'm hearing you say.
Yes.
Legally. Just don't rob a bank or commit some other crime.
Right.
Okay, that's all I had. Thank you.
Councilmember Hall.
First of all, I just want to say thank you to all my fellow council members for so thorough and detailed and all the questions that we've already covered. So I just marking things off my list, but I still have a couple of questions and I'll try to be brief. I think this one is for Dr. Cook. I've had a lot, I think we've all gotten a lot of feedback, some very thoughtful questions from our residents about what exactly this would all mean and how we implement it. And one of the things that we haven't touched on is masking in children. And we've had quite a bit of, I would say quite a number of questions, or at least I have, about requiring masks for children. And I know this is an issue with the schools trying to make decisions too. And I was pleased to see that we did raise the age from 2 to 6, because I think that maybe has taken care of some of the concerns with young children. But is there any adverse effect for children, socially, developmentally, to be encouraged to wearing a mask during this time? Anything that you can speak to on that?
So the American Academy of Pediatrics also gave guidance on mask wearing and particularly how it relates to reopening schools. And so the recommendation is that children over 2, it is safe for them to wear masks. That being said, it may be difficult to get them to wear masks. I think you have to weigh the risks and benefits of each situation. I think children are very adaptive, and so, initially I try to relate it to car seats. When we first started mandating car seats, parents were thinking, oh, this is going to be impossible to make my kids sit here. They won't do it. But, when it's for their safety, there are things that we can require our children to do, and they get used to it. So I think it is reasonable for children to wear masks, particularly if they practice with it in small doses. The expectation on the plan for reopening schools will be that masks are worn. There will, of course, be exceptions for developmental stage, frequent breaks when it would be safe for kids to take their masks off. So I think it is reasonable, and I think it would be in the public's best interest for as many people to wear masks as is possible. So I don't think there's any problem with us asking for children 6 and up to wear masks.
So that was my follow-up question. Do you feel like we've hit the right age by changing it from 2 to 6 years old?
Yes, I do. And I think that's the age of children that we're going to be trying to expect them to do that in school as well. So I think it's a reasonable age to pick.
And I'm not sure if who would exactly respond to this, but maybe Ms. Walker. So again, related to this particular issue, after rereading multiple times the exemptions that we have in place, it seems like we've tried to cover outdoor activities that children may be participating in, outdoor sports, outdoor camps, and that if social distancing is possible, then it would be there would be a little bit more discretion on whether you're wearing a mask or not. Am I interpreting that correctly?
Yes, I think that's correct when you read through the exceptions, that in those situations where you're in an outdoor communal area, that you're able to maintain social distancing, you don't have to wear a mask. And then, of course, if you're engaged in high-intensity activities, so youth sports, those type of things, you wouldn't have to wear a mask as the participant in the sport.
Okay, thank you. I think the next question, I want to also circle back to the bar closing times. I've heard from quite a few of bar owners and in Ward 4 in particular, and a lot of different situations within our bar owner community, some that are just bar owners, bar service only. They don't provide food and are not, don't have quite a few others that do have more flexibility. And so I still really do have some concerns in this area. And I also want to say that I fully understand where you're coming from, Mayor Park, and that we have to consider the big picture. But, for example, some of your crowd is not the college student crowd, and their customer base doesn't really pick up speed until later at night, and they're already not experiencing any kind of capacity issues. Their concerns are, that they're trying to rebuild their business just like everybody else, and they are not experiencing the capacity issues that we might be seeing with some of our bars on Campus Corner. And related to that, they're also afraid that they're going to have to lay off some of their employees if they're going to have to close early. So I am open to the suggestions from Councilmember Petrone and Councilmember Holman that we think about that a little bit more. And, we want to offer an amendment tonight or see how it goes and come back and revisit it. But I do think we need to take that into consideration also, dealing with some very different circumstances that we know already will have an adverse effect on those that are not even coming close to capacity. So just want to throw that in. The other interesting question that I got today that made me really think about this is our elections. We have 2 elections coming up during this period, and one of them is specifically a municipal election, and of course the other one is a very important presidential election. But how does this, if the elections are run by the Cleveland County Election Board, how does this apply to our polling sites as far as mask requirements?
The Cleveland County Election Board is part of Cleveland County, which is a subdivision of the state. And so the position we've taken up to this point is this isn't something we can really enforce on other political subdivisions. However, the polling places are at a variety of locations across the city. It's not on state-owned property, and it's not part of the election board property in terms of where the different precinct elections are held. So I think the expectation would be that at the very least, the people going to vote would be wearing the masks. And we would certainly ask that those working the precincts would be wearing masks as well.
Okay. Yeah, I just was thinking that we may have to have some conversations there to ensure that we're doing everything possible to encourage voter turnout, and make sure that the city and the county are cooperating and doing whatever it is we need to do to guarantee the most robust voter turnout that we can get. But I thought that was a really interesting question. Let's see. Signage. I think that's all the questions that I have for now. Thank you. And thank you all for providing your expertise. Always appreciated taking your time to spend with us to help us sort through this.
Okay. Mayor, we have, I see some other council hands with more questions, but I would encourage you to go ahead and move forward with public comment at this time. These citizens in the audience have been very patient waiting their turn to speak, and we have several that would like to address the council. So for those of you that would like to speak, you'll need to enter the council study session room. There's a laptop in there, and sit down in front of the laptop. Go out into the hallway and around, please. And yeah, just kind of line up and go one at a time. Give us your name and then state your comments.
Am I ready?
Okay, thank you, sir, for your patience.
You're welcome. I live in Ward 6, and I'd just like to voice my opposition to this ordinance for the following reasons. I'm going to take about a minute or two. This week has been the 10th week where we have declining deaths in this country due to the Chinese flu. We have expanded the number of positive cases. They thought that we had 2.5 million, but it came to 26 plus million. You know, it looks like we're getting to where we need to without these masks being required. 1, 2, we know that the mortality rate of Chinese flu is way lower than a typical seasonal flu. And so again, we don't do—
Sir, it's called the coronavirus.
It's my turn to speak, please. And I have a First Amendment right, and it's a Chinese flu in my book. Okay, so if you want to call it COVID to make y'all happy, okay? However, with that being said, the point is that the mortality rate of this virus is less than a typical flu season. Yet I don't see these kind of efforts being put forth during a typical flu season. And finally, you want to wear masks, you can recommend people wear masks, but it's not going to affect people under 41. 2, the masks, the N95 only filters 95% of the particulate matter it's designed to filter. It's designed to filter down to 0.3 micron diameter of particulate matter. The virus is 0.1. So this thing will pass through freely through the mask. And after you're wearing it for about 20, 30 minutes, the moisture from your breathing will defeat the purpose of this barrier. So, you know, the science doesn't really support all these arguments. And the other thing that's interesting is that y'all are talking about maybe extending this past maybe November because of the upcoming flu season. You know, this has got to end. People need to get back to what they're doing. And if you want to wear a mask, that's fine. But you shouldn't mandate it on everybody because, again, the science doesn't back up. A Stanford doctor has stated that wearing a mask is only to alleviate social anxiety. So if you want to be controlled by your emotions, go ahead. But the science doesn't back up what you're trying to do. Thank you.
Thank you, sir.
Somebody.
Mayor, are we still doing name and address?
Supposed to be.
Thank you.
Name will be sufficient.
My name is Catherine O'Brien. And so far to me, this discussion here that you people are having within yourselves in some items more than one time is ridiculous. The COVID virus definitely came from China. It took a woman 17 years to track 600 miles to get the bat and develop the virus. And anybody who could tell us if there was a cure for it is dead or missing. And United States officials in our government knew they were over there, and they knew about the virus in 2018 and did not warn our government. And you people, the biggest place that this virus is spread is the grocery stores. And they have made a mint on everybody. And they should have to provide masks for people who don't have them in the grocery stores. I went to Crest, there was 3 people in the whole crowded store with masks, and I was one of them. And then you allow a stupid BLM march in the middle of a pandemic? Where do you come from? What's in your minds? What's in your brains?
Thank you, ma'am.
Maybe it doesn't matter now. Bryce, probably okay.
My name's Art Schipple. I live in Ward 1. This is an N95 mask that that gentleman was just talking about. Like he said, this mask doesn't protect me at all. It might protect you if I'm coughing or sneezing, but probably not so much because any exposure on this mask is going to stay on there. It's like getting muddy. That I can't see it. You can't see it. I'm handling this thing. Other people are handling their masks. They're spreading the contamination. This is why hospital workers have a higher infection rate, because they're not properly handling and disposing their masks. There's only a limited time, like that the previous gentleman said, when this thing actually is filtering, because then my moisture accelerates that. Wearing this mask, unlike what the woman said before, if she was to read in anesthesiology journal or anesthesia journal, they point out that they measured the end-tidal carbon dioxide levels in 4 anesthetists wearing the same design of mask before and after a 20-minute procedure. The mean baseline end-tidal carbon dioxide was 5.18. 20 minutes later, it was 5.95. So wearing this mask for 20 minutes went up about 15, 18% carbon dioxide. This is damaging to people who have like people who have diabetes, people who have hypertension. This mask is a threat to their health. You're actually making them more susceptible. You're stressing their immune system and endangering them. Which in and of itself is just, silliness. We do need to protect the at-risk people, but having them wear the mask actually makes them more susceptible. They need to be sheltered, and people need to wear this mask when they go deal with at-risk people. And then they need to throw the mask away. Like that woman said, there's not an endless supply of masks. I have been by the hospital. I'm the only person in there wearing an N95 mask. And that's only because I had it from doing construction work. These are not available. And you're going to, mandate that everyone go out and purchase something. That's not constitutional, that you mandate people go spend money. The whole reason Obamacare is unconstitutional. You cannot mandate people go out and purchase, whether it's a material or a service. So you're going to mandate they do something that's actually dangerous to their health. If you're really worried about this stuff, we should actually be happy that the kid. Oh, and another thing, when you cut the hours on the bars and the others, look what happened in New York City when they cut down the subway and bus runs. All of a sudden, the metropolitan transit workers had a much higher incidence because the buses and the trains were extra crowded, because the poor people who don't have cars and don't live in the suburb actually had to use metropolitan transit. So this is another example of policies that somebody thinks are a great idea, but it'll just make things worse. And like I said, even the federal government can't mandate somebody to go out and buy something. So I don't know, there's a lot more, but clearly nobody's actually interested in science, because if you were, go to Wiley Online and look at the scientific journals and papers there. I mean, there's a lot of stuff that has been done by anesthesiologists in particular, are really familiar because they have to wear masks all the time. And they know to take the mask off as soon as possible. Anyway, I don't mean to tie up everybody else's time.
Thank you, sir.
Name's Jerry Drury, 6. Gentlemen, and ladies, I have not seen such a one-sided thing in all of my life. This is not a fair debate. You guys have got one opinion. I can't believe that there's no opposing experts that you've got on here to listen to any kind of contrast. You've got only the people that agree with what you want to say, and that's all you've got. You're not listening to us, not listening to common sense. What I don't understand is how you guys are believing the authorities that 3 months ago that the masks were useless. They said that the mask wouldn't even stop. If anything, they were dangerous. I've got on recording, and I don't know if I can show this or not, but do I have permission to do that?
What is it, sir?
Watch this, if I can get this to come up.
I don't know if I'm comfortable with this.
Now, when you see people,
yeah,
China and South Korea, whatever, everybody's wearing a mask.
Recognize this guy?
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you think masks, you
okay, thank you, sir. I think we understand the gist of your video. Thank you. That's plenty.
Look at the films.
I'm not being hilarious, ma'am. I am telling you that you are listening to someone who lied then or is lying now. Either way, they're liars. This is proof that you guys have got one thing on your mind, one agenda, and that is to put these masks on and to force us to do this. You don't have the right to. You guys were talking about hospitals. How many of these new cases are being sent to the hospitals? They're being in the hospitals. So the people that I have talked to have caught this, they were sent home. They were sent home and not in a hospital. So what percentage of the people that are catching this stuff are being put in a hospital and being cared for? I want to say very few. I don't know of any. Do you? Where are your facts? Okay. You're not going to listen to us anyway. It's obvious you've already made up your minds what you're going to do. You don't want any opposing expert showing up. This is just wrong, guys. Are you after our safety, or are you after controlling? And it looks like to me that's all you're after. And I'm very disappointed in every one of you. There should be some more common sense. There should be somebody with an opposing viewpoint, but I haven't seen one. Where is that person? Where is that opposing viewpoint from an expert or from a doctor? Is all of the doctors thinking? So anyway, that's what I've got. For what good it is, I really don't think you guys are listening. I think you're going to do exactly what you want to do. And I think there's some recourse that we as citizens will take. We've already taken it once. And Maria, you got slapped on it. You're going to get slapped again from
Sir,
the
you
federal.
can call me Mayor Clark, and thank you for your
Mayor
comments
Clark,
this
that's
evening.
fine. I apologize. I apologize for not doing that. But I am a citizen, okay? You need to listen to us. And if you don't listen to us, I think there's enough of us that are going to turn around and do something to make sure you guys are recalled, okay? Thank you.
Thank you, sir. I appreciate that.
Sir, under the Parker.
Hey guys, my name's Ricky Stapleton, local business owner. I grew up here in Norman. Graduated high school here in '81. I've been around here for a while. Raised my family here in town. My kids go to school here. The long and the short of it is I haven't been to very many council meetings, but I sat back and I watched just a little bit as I showed up, and it's pretty obvious that you guys have already made up your minds on what you're going to do, and that's very unfortunate. In my business, I allow people to make that decision, and for government to overreach that position and take away that freedom for somebody to say, hey, if you don't want to wear that mask, that's your decision. I certainly understand your arguments, and they're valid. The people that buy into that need to accept that, and they can choose to wear that mask if they choose to do so. I went into several other people's businesses today to wear a mask, and I don't have a problem with that. Certainly want to respect that. I believe that if you all would consider listening to the people of the city of Norman, you'll come to a different conclusion. With an open mind, it's much like a parachute. It only works if it's open. Thank you for your time.
Thank you, sir.
Hello, council members. My name is Taylor Rogers, and I live in Oakhurst in Ward 1. And I am here today to voice my support of this ordinance. I want to tell you guys a story, and bear with me because it is relevant. But my best friend is a fantastic person. She's amazing. She is the hardest worker that I know. She is a single mother, and she has 4 kids. She's been out of work since February with her son, her youngest son, who has brain cancer. She's been in and out of the hospital with him. And thankfully, it's looking like it's good. We have her 30-month appointment this week. But her being a single mother, she doesn't really have people to help her out. And with her youngest son, just having had brain surgery, she really can't leave him alone. She can't leave him with the other children. It's kind of babysitter. And so sometimes she has to take him grocery shopping. And they wear masks, they sanitize the cart. They're so cautious, but other people are not. And other people have no regard for social distancing, and they aren't wearing masks. And so wearing some sort of facial covering at the very least protects the most vulnerable people in our population. And that, I think, is what people are failing to see. They get so caught up in their liberties that they're failing to see that there are people that are so highly at risk. I mean, this is a 6-year-old boy. Yeah, it's looking like he might have beaten brain cancer, but his immune system is still compromised. If he were to catch COVID-19, he would die. And it's so easy. It's so easy to prevent transmission. I mean, wearing something over your face reduces the chances significantly. And no, you don't have to go out and buy something. You can make something out of a t-shirt or a towel. Just wear something, some sort of fabric over your face. And I know we all have fabric. It is not difficult. It is the absolute least that we can ask to take care of our neighbors and to take care of the most vulnerable people in our town. Thank you for your time.
Thank you, ma'am.
Good evening. My name is Rick Peschke. I'm in Ward 6. I came here tonight to listen to what was going on. Thought we were going to discuss if this is going to go until the end of November or not, or if it's going to be a shorter period of time. Instead, we digressed to COVID-19 and education, but we all know a lot about it. I know a little bit about it. I'm diabetic and I have 8 stents, so I have medical conditions. Believe me, I know what's going on with COVID just as much as you do. You digress from what's going on. We were going to discuss what time period you're going to have this mask or not. Let's stay with that and get that discussion done and then go on to something else. And young man, I applaud you for getting insurance, but it's not going to make any difference how many hours a day a bar's open, how many people get there or not. Let's focus on what's going on here, what we're supposed to be talking about. We've got a lot of other issues to take care of, and you all are talking about stuff that everybody already knows about. Thank you.
Thank you, sir.
My name is Joe Shepherd, and I'm from Ward 5, and I'm wearing a mask for the very first time today. And it's to show my disdain for public officials who think they have the right to control other people's lives by forcing us to wear a mask, which is unconstitutional and illegal. I do not have to wear a mask. I do not have to have a test from any medical official. I do not have to have a vaccination without my consent. I do not consent to any of the above. As far as I'm concerned, the purpose of COVID-19 is to steal the people's money, oppress them, and take their civil liberties away. It doesn't have anything whatsoever to do with the disease. It's about enforcing Marxist controls over the populace, and especially putting the small businesses out of business and killing the independent jobs that are out there. So the only people left with employment will be government officials and corporate employees, like a fascist Marxist society. That's the real goal that's going on here. Nothing to do with anybody's medical condition. It's all a pack of lies.
Thank you, sir.
Council members and Mayor Clark. My name is Sean McKenna, and I'm a longtime Norman resident. My appeal to you and speech to you today is not to persuade you one way or the other to pass or not pass this, but I would like to offer some of my insight into how we can make this ordinance better. In recent times, we're trying to eliminate and reduce potential conflict between police and our citizens. An ordinance like this is going to generate calls for service. I don't know how many of you have been down to our dispatch center. There's only 3 or 4 dispatchers that are answering 911 calls as well as non-emergency lines. They do great work, and I would hate to see them get bombarded with calls for people not wearing masks. One of my suggestions would be on our proposed signs that we're going to give to the businesses is to maybe have some language or create some other call center or some other way that they can notify maybe the action center or something else, so we're not overwhelming our emergency services where they can't answer a phone call. The next thing that I think
Can I comment on that real quick?
Absolutely.
I share your concern, and I actually have asked our IT department under both the police department and the action center to create a specific link for concern so we don't overwhelm our dispatch department. So thank you for sharing that.
Great. And then my other concern was with the language of the ordinance. As you know, I really appreciate Councilmember Holman bringing my question that I posted on the ward. But one of my concerns, I'm currently in law school now at OU, and the way the ordinance is written, it says, violators can be subject to these other ordinance violations, including trespass, interference, and some of these other things. I think we should make that language a little more clear and say, like, something to the effect of, we should, people who commit other crimes as a result of this, such as trespass, interference with the official process, disturbing the peace, may be cited for those ordinances. Because the way I was kind of reading that, it almost sounds like if you violate the mask ordinance or the, whatever we're titling it now, that you could be subject to prosecution under these things. And I understand from Chief Foster and the city attorney, that's not the intent here. I don't think that's the intent of this ordinance, but that's kind of how it's reading. I think we should clean up that language, make that more clear, and then also consider signage for our citizens of, hey, this is what we need to do, so we're not overwhelming any emergency response and all that stuff. And I appreciate you reaching out for IT. That's my concern. I want to eliminate harmful interactions, and I also don't want to put our law enforcement and citizens in a no-win situation. We all know that enforcing these types of things can be viewed by some as petty, and it would increase the likelihood of some hostile interaction between law enforcement and citizens that I think we should try to avoid. And it's up to you council members, to be innovators and be leaders and make Norman, a front runner, figuring out how we can accomplish these objectives of keeping public safety, keeping people from getting sick, and not burdening our police and creating harmful conduct. My suggestion was, and I appreciate your time.
Thank you, sir.
Hi, CJ Baxendale. I'm in Ward 2. Why, as Americans, 3 months ago, we were told by our government leaders that we should absolutely not wear a mask, and we're expected to follow your guidelines like sheep, and you were telling us exactly opposite, and again, expecting us to fall into line like sheep. Of course, we are questioning our government on this. If your experts were so wrong 3 months ago, why are you still advising us on this day? Because the truth is, cloth masks are horribly inefficient filters and leak due to poor fit. Surgical masks are variable in their filtering abilities, also are poorly fit. Fine N95 respirators filters, but are reserved for healthcare personnel. A situation where mask wear is useful is for healthcare workers using a properly fitted, tested N95 respirator as PPE to care for patients with suspected or confirmed coronavirus. Social distancing appears to be much more effective than mask use at preventing the spread of COVID-19. COVID is far from over. It is not time to get lax with our hand washing, face touching, and the social distancing. Clean surfaces and mask wearing may also have a positive effect. That said, there is a point where we must balance our desire to secure ourselves from the disease with the need for the God-given rights of life, liberty, and the pursuit of happiness. That includes holding all levels of government accountable when they fail to guarantee those inalienable rights under the guise of security. I'm against wearing the mask. I think it's the right of a person to choose whether they want to wear it or not. I realize there's people at risk, but those people should be taking precautions. I appreciate you listening to me.
Thank you, ma'am.
Hi, I'm Gary Barksdale, and I'm in Ward 8.
Thanks for your chuckle, sir. I appreciate you showing me your back. I appreciate that respect. It's what I expect out of this council. I'm not here to say that I favor or oppose.
Mr. Barksdale, there's a lot of feedback. I can't hear you very well.
Of course. I'm not sure why there's feedback.
Sorry, Mr. Barksdale. I think it's coming from Brenda's actually. Can you mute yours?
Mute mine?
I can't mute.
Not you, Mr. Barksdale. It was Brenda's was on in the other room.
Just a moment. I have to leave the cart mic open. That's how people are hearing you all in the audience. So I can't mute that one, but I can turn the reverb down on that mic a little bit possibly. So go ahead, Mr. Barksdale.
Okay. I do not oppose any type of wearing of masks out of respect for people with immunodeficiencies that I'm aware of. I wear them. If an employer requires of me to wear a mask, I will wear one. If an establishment that I go into requires of me to wear a mask, I will wear one. But the question that I have and the problem that I have is I have a problem with government mandates. Is this a virus that's so smart that it knew to infect large gatherings in churches, but knew not to infect the mayor's protest gatherings? Is it that smart of a virus? Obviously it's not, because 327 more cases came up in a period beginning June 16th, and more than 50% of those cases were the same ages of those thousands that gathered the 14 to 16 days prior to that, which is the incubation period for this virus. Is that virus so smart that it didn't affect the protest, but it does affect churches? I don't think so. Now, we could all say, well, it was because those kids that were led by the mayor to violate her own proclamation wore masks. Well, you know, there's a reason that I wore this mask. Because to be honest with you, you don't know the usefulness of my mask at all. You have no idea. Do you know its thread count? Do you know whether it's a 50 thread count, a 100 thread count, a 200 thread count, or a 1,000 thread count? Unless you're discussing the true science of this nature, you have no business dictating that somebody wears a mask because you know not what its usefulness is. It's kind of like taking a golf ball and you try to throw a golf ball through chicken wire. It ain't going to make it. But you throw that same golf ball through hog wire or barbed wire fence and it'll make it through. You have no idea what the thread count is of this mask. So this mask is as useless as the mayor and the city council because it is a 50 thread count. It's useless. You want to dictate a mask? All right, you don't even have any idea what the people are wearing. And then I can take this mask and if it doesn't have this written on it, I can wear it this way. I cough through it. My respiratory particulates are on the inside of it and I turn it around the other way. When I take it back off and put it back on, and now I'm propelling respiratory particulates that I put there earlier at a much higher rate than I was before. It's not science that you guys are talking about, it's control. Now, if an employer requires it of me, I will wear one. But I'm not going to wear one because you guys are going to require it of me. You guys are government. You have no business telling me what I should and shouldn't wear. Now, this is just a method of control under the guise of safety. Otherwise, we would require us all to wear shirts that say socialism kills, because more people have died at the hands of socialists like Stalin, Castro, and Hitler than are dying from this disease. We should all start wearing shirts right now that say socialism kills, because it does. Now, if you want to talk about making people wear stickers or labels to exempt them, you mean stickers kind of like those ones that say T4 on them? Or maybe stickers that were green triangles or brown triangles or red triangles? It's about control, and you know full well it's about control. I will respect the elders and the people that I know that I need to wear a mask around, but I'm not going to respect any edict from a government official telling me what I should and should not wear when they really don't have the science down. Because this mask, and you can ask the two scientists who are co-signing on this. I know you guys have already made up your mind. What I say here is not going to make any difference. There could be thousands of people out here that are opposing this, and you guys are going to decide what you've already decided. You've already made up your minds. This mask is useless. Thank you.
Thank you, sir.
Hello, my name is Jared. I'm from Ward 2. This right here is my daughter. She has pulmonary lung disease. She was born 1 pound, 13 ounces about 20 months ago. Since then, me and my wife have social distance before it was cool. And I think that's right for a lot of people. But I do not, under any circumstances, think that it should be a forced mandate by this municipality on its people. Okay? I have a few other issues. My biggest issue is the way that this meeting is being handled. The fact that it has gone onto this digital platform versus an in-person meeting. It is almost incoherent that you cannot understand anything that's going on when you're in the meeting hall next door. I think that all government meetings should be done in person. Everyone should be allowed to speak their mind. And because of that, I believe that there is a lower turnout here than there should be. I also believe that you guys have already made your decision. You already know how you're going to vote. You don't care what your people of your wards say. I have heard probably 10 to 12 people talk in opposition of this, and I've only heard one person that supported it. You know, if I was an elected official and 12 of my constituents came to me and said, do not vote for this, yay, I would have to say, you know what, I'm going to vote no on it. I understand you may have talked to other constituents here recently on the phone, but this is unacceptable. You are overstepping the reaches and bounds upon your city ordinances and what was set forth by our forefathers. Please don't pass this. Don't force people to wear something that shouldn't be. It's out there for people that need it, and it should be available to people that need it, like my grandparents or my daughter. But every day when I get out to work, I have responsibilities, and wearing a mask hinders those. I have asthma. I can't wear a mask. My daughter with pulmonary lung disease cannot wear a mask, but we take the correct precautions, even though she is at risk, to make sure that my daughter does not come in contact with people that are sick. I'm not scared of COVID. COVID is a minor disease. It doesn't take a lot of infants, so I'm not too terribly worried about my daughter. But flu kills kids every year in droves, and we don't do this for that. So what makes this so different? I am begging you to vote nay on this. You are going to kill people coming in from out of town that spend money here. I own a business in Ward 2, and you are going to have so many issues that you have to deal with because of this. And you're going to have a lot of people that you're going to write a lot of tickets to, and you're going to see a lot of people in court. You guys have a great night.
Thank you, sir.
Okay, who's next?
I already talked. I just wanted to point out.
Hello, council and mayor, city council and mayor. I want to thank you for giving me an opportunity to speak with you this evening. I'm here in response to a specific topic, and I have some specific things I want to say. I don't want to go into there's a lot of complexity, but I just want to kind of focus on some numbers that I pulled together. So my name is Misty Pinuelos. I'm a PhD candidate at the University of Oklahoma in the history department, and I'm working on a dissertation in on the fiscal and monetary policy of the Cherokee Nation in the 19th century. So that's who I am. So I'm here to suggest that the mask requirement is not justified based on the numbers. And I have three kind of little topics that I would point out. I want to talk a little bit about the increase in the numbers, excess deaths, and I just might say a word at the end about the PPE. But one of the reasons you're having an increase in numbers is because, and let me just tell you where I'm getting these numbers. Every day, the state of Oklahoma publishes a report, they call it a situation report, and they report all the deaths, all the hospitalizations, positive, negative, total cases. And so what I did is I've gone back through from March 25th when they started until yesterday, and I've put all this data into a database. So all the numbers are right here. And The reason I'm here is because you reported, you said we're going to have a mask ordinance because there's been a spike in the cases. But I can tell you from this day, and I thought we were going to have an in-person meeting, so I have the data for you too, if you want it. But this data does not, first of all, if a pandemic is an exponential growth, these numbers don't support that. And the other thing they don't support is justification of imposing a mask because of a spike. Because if you look at these numbers, we've had spikes before, right? I mean, it spiked, and I'm sorry I didn't bring my glasses. On April 8th, April 7th, we had a spike, 16 deaths, 12 deaths, but then it goes back down. Oh, wow. Let me see if there's somebody, we'll see. Oh, that helps a lot, yeah. But then the next day it was like 1, then 8, then 6, 2, 3, 9, 15, 8, 5, 3. So you see that you're not seeing this kind of exponential growth, right? It's uneven, it's up and down as opposed to consistently going upward. So that's a problem. And that peak, the peak of the death rates peaked on May 29th. Since May 29th, right here, you can see that the death rates have steadily, there has not been an increase in the death rate since May 29th, based on the Oklahoma State Department of Health. The other thing, so you've had this increase. I mean, you've increased testing 36,000%. Positives increased only 9,000%. Negatives increased 41,000%. So in the same period, in this increase, right, the numbers aren't backing up that this is a dangerous situation we're in. If you look back historically at the death rates from 2016, 2017, and 2018, we don't have data for 2019 yet. This data is coming from OK2 Shared, which is our vital statistics. The problem here, in 2016, 107 people from all causes, 107 people a day were dying. In 2017, from all causes, 110 people died a day. In 2018, 112 people per day died. Okay, so with those numbers, what we would expect to see in a normal year right now for the period of the 104 days that these statistics cover, for that period, we would expect in this time period to have 11,128 deaths. What we've had in this period, total deaths, is actually, as of yesterday, and today I saw is 404, but as of yesterday, that was 399. So that is way, way less than 11,128, which is what we should be seeing in a normal year. Instead, we're seeing, according to this, I mean, at least with this situation, which I don't want to debate, you know, what it is not, I mean, we're just looking at the numbers. Based on those numbers, this situation does not even rise to that. There's absolutely no way, there's no evidence whatsoever to, first of all, suggest that we're having a pandemic, because these numbers go up and down. They have to go up, and instead what they've been doing since May 29th, that's what these two columns on this side are, is the death rate. It's this death rate for everybody and the death rate for positive. And they're very, very, the difference is minimal. But these things, as of May 29th, they're going down. They're not going up. There has not been one increase in the death rate in Oklahoma since May 29th. And now here we are a month later, and everything is getting much more draconian than it was. So that's basically, like I said, the historical data doesn't support the fact that a spike is going to immediately precipitate a pandemic, because we've spiked and gone down. I mean, the highest death rate we ever had, the very highest death rate was 21 per day. That was the highest, and that was on April 21st. So there's just not enough evidence There's not, and there's too many questions about many things that people brought up tonight. There's questions about the testing process, and I'm not going to debate those. I'm just saying there are questions. And if there are questions, until you know for sure, please, in the name of Jesus, please do not implement this, because it is going to prevent me personally. I won't be able to go to, if you enforce this, I won't be able to go to a grocery store. I won't be able to do anything, because you've made it where you have to wear it everywhere. And I'm not the only person in the situation. I just, it's personal, religious, whatever you want to call it. I have personal reasons for not wanting to wear the mask, and I won't wear it. So this could be, this could be Armageddon for me. So I hope that, I sat down and I really tried to pull this information together. And again, I will leave this for the clerk, and I hope she'll distribute it to you so you can look at yourself. And I just want to urge you, please, to reconsider and really look at the numbers here, because the numbers are not backing up a spike. Thank you so much.
Thank you, ma'am. And Madam Clerk, will you please make sure that's scanned and emailed to everyone? Thank you.
Yes, ma'am.
I think she's talking.
Oh, I'm sorry. Excuse me. Did you have a question?
No, I just asked the clerk to scan your documents.
Okay, I thought you were trying to talk to her. My name's Jack Dawson. I am from Ward 8. I haven't been there very long. I've been in Norman 37 years, but I've only been in Ward 8 about a year and a half. I'm a big advocate of distancing. I'm a very happy, very proud great grandfather for the first time. I didn't get to see the kid for 2 weeks, and I've seen him 3 times now, but I still haven't held him. I haven't gotten within, well, maybe I got 5 feet, but I've not gotten really close to him. During the height of the panic about COVID-19, when we didn't know anything about it and everybody was panicky, I walked out of 3 different 7-Eleven stores simply because they were too crowded. The other stores were all closed, so everybody would go to 7-Eleven. But I don't like masks. And I believe a lot of what I'm hearing about how they don't work all that well. But, well, there's a gentleman coming up behind me, and I guess maybe he'll be the last one, but he's got some amazing information for you, so I don't even want to get into that. But one thing I was unable to even discern this evening, because the sound system in there wasn't very good, and when people talk in masks, I don't hear them that well anyway. But I read somewhere that that the proposed thing would last until November 30th, and I wasn't able to find out today whether that was what we're actually talking about or not. But when I was talking to my old friend Steve and my new friend Kate the other day, I said to them, why couldn't we just make it 30 days? And if the perceived need was still there, add another 30 to it. Or maybe add another 30 after that. But as far as I'm concerned, I've found out just a couple weeks ago just how strongly I felt about masks. I walked into my favorite bicycle shop in Norman, the Buchanan Bike Shop. I've been going there for years. But when I walked in, a guy in a mask came out and said to me, do you have a mask? And I said, well, I got one in my car. And he said, well, you don't have to have it to come in here. And I said, well, okay, but something inside me just rebelled. And he was busy anyway with another customer. So I just left and went to another bike shop. And I came to the conclusion that I have great respect for business owners. And if a business owner doesn't want me walking store with no shirt, no shoes, no mask, that's their prerogative. But if the city government of Norman is going to require all businesses to require masks, which probably isn't even legal anyway, but I'm just not going to buy anything in Norman. I'm sorry. I mean, I know a lot of business owners in Norman. I felt sorry for all the ones on Lindsay Street when that goofy project dragged on for so long and caused so much pain and suffering from them. But the only thing I can say now is I'm not going to spend any money at all in Norman while that is in effect, except for pharmacy. I take 5 different medications, and Dave's is a great place. And I don't have to, in fact, I can't get in the store because he locked his door up a long time ago. So the only way to do it is through the drive-in window, which I normally avoid like the plague. But if it lasts 6 months, I'll shop elsewhere for 6 months. Not to say that if at 10:30 at night, I look in my refrigerator and I see I don't have any OJ in there for morning, I might run over to the 7-Eleven and buy a little pint or something, but I'm not going to go grocery shopping in Norman. I'm not going to go clothing shopping, hardware shopping, anything. I'm not going to buy gas in Norman. Why should I? I'm in Oklahoma City at least 2 days a week. All I got to do is look at my gas gauge. I mean, there's no chance of me running out. And I was actually a little disappointed with Stephen for not bringing that up. But anyway, I will let you go now. And I hope you would at least make it 30 days. And another thing, one of the gentlemen that preceded me, he told me about something that he forgot to mention. What he said, now as far as I'm concerned, this is just hearsay because I don't know, but what he said is the city charter says that the new members should be sworn in first before the vote. I don't claim to know what it is, but that's what he said. And I would surely rather have the new city council vote on this than the old one, the same one that couldn't find one single person to not vote to fund the police. I think that's craziness, but that's a different story. But anyway, this next gentleman's got some real good stuff for you. Thank you.
I look forward to it. Thank you, sir.
I'm back. My name is Sergeant Civil, Ward 1. There are a couple things I forgot to mention. One, you had somebody who was talking about epidemiology. There is a thing in epidemiology called R0. That is the reproduction from a 0 point in the population. Although we are long past that and have been ever since Chinese New Year, actually, when they had everybody into Wuhan and sent them back out to the world. But what this lady was talking about earlier about the mortality rate and the case rate going up and down, spiking on the incidence, that is something that typically happens once an infectious agent is reaching a certain point in the population, because when it has already infected certain people, they've already had it and they're over it, or when they run into somebody that's immune, a disease walks into a corner. Epidemiologists say that a contagious respiratory disease requires about 250,000 people within 2 days travel of each other. This is one of the reasons why plague in the past run out of susceptible victims to find themselves in a corner where they could not transmit to anyone new. And so the infectious agent actually died out. But there have been many, many more infectious agents in the past, and we've never mandated masks. I would like to point out that the reproductive zero rate for this COVID. Can I ask y'all to quiet down a bit? Okay. The reproductive zero rate for this is calculated as 2.79. It is spread by respiratory droplets and bodily fluids. Other diseases that are spread by respiratory droplets, by coughing and so forth, smallpox, 3.5 to 6. Pertussis, the whooping cough that runs around every year through this state, 5.5. Rubella, 5 to 7. And then mumps, 10 to 12. Chickenpox is spread by an aerosol. Aerosols are little tiny droplets. I mean, when they say respiratory droplets, they're talking about things that are like larger than 5 microns, or I mean, larger than 5 millimeters. And then the aerosols are much smaller particulates, like the seeds of a raindrop. And aerosols, chickenpox spread by aerosols is a 10 to 12. Okay, that conversation else somewhere else. Chickenpox aerosols 10 to 12, measles 12 to 18. We have never mandated a mask for any of these things that are vastly, vastly more contagious. And in fact, in cases like measles and chickenpox and mumps, they're vastly more dangerous. Mortality rate on this thing is lower than 1%. The lady was talking about the kid with the cancer. There is no child under 10 years old anywhere in the world that has died from this. 0. And in fact, over 70% of the mortality from this is people 75 plus with at least 2 comorbidities. You know, so there's no science to support this, none. And I don't know, I'd ask you to think about that. I know you've already made up your minds, but you know, think about the voter. Never mind the voters. Think about the science, because it does not support what you're saying. Thank you.
Thank you, sir.
Okay, Bonnie Campo, Ward 6. I am wondering if you all can speak to the idea that Guthrie tried to mandate face coverings. And because of a lawsuit that was dismissed, do we know from a legal standpoint what Norman could anticipate?
You want me to go ahead and answer that, Mayor?
Yeah, I'll let our city attorney jump in on that one.
Okay, sure, I wouldn't be surprised to see a similar lawsuit to what happened in Guthrie. That lawsuit was dismissed after the city rescinded its mask requirement. There has been some additional case law come out throughout this pandemic related to some of the restrictions and things that cities and states have been imposing. And so I think there's probably some helpful information in those cases for us. But there's not a case yet that says yes or no, you can impose a mask requirement specifically in this pandemic.
Is there precedent set anywhere in Oklahoma, or are we looking to maybe other states to define that?
There's not precedent. Oh, go ahead.
I was just going to say, entire other states have mandated this, and it hasn't been deemed unconstitutional yet. And the U.S. Supreme Court did rule on our restrictions regarding churches and businesses and found that constitutional. I think that could be a precedent you could point to.
Okay, so should a lawsuit be filed, do we know how that would be handled by the city?
Well, it depends on what's filed, but of course we would represent the city as we do on any other litigation and present the information that we have.
That's all I have. Thank you.
Thank you.
Hello, my name is Madison Molitor. I'm from Ward 1. I was watching the live stream at home and saw a bunch of people spreading misinformation and pseudoscience and all of these racist terms labeling the coronavirus. And as a citizen of Norman, a student and a full-time essential employee, I would love if the city were to say, yes, everybody has to wear a mask, because when my has to say, no, you can't come in, I can back it up and say, this is a city mandate. It gives a business a more solid ground to operate off of, because while businesses are autonomous units, they have to be backed up. And if one business requires a mask and another doesn't, that just spreads to the misinformation of, do we need a mask? Do we not need a mask? And so if I could look at my customer and go, no, you have to wear a mask because the city of Norman is mandating it. It gives worker a lot more wiggle room, and then me as a citizen a lot more a better sense of safety walking into a building, knowing that everybody's following the same regulated policies. And even if I'm not at risk, or if I'm not a carrier or something like that, my mask could help save somebody else. And I think that if we step back from an individual standpoint and look at this as like what's best for our community, and look at it as a like what can we do to promote communal good, then we should pass this mask policy, even if it goes through November, because when people come back to campus here in a few months, we're going to see a huge increase of social gatherings. We're going to see a huge increase of people from out of state, maybe, with the unknowns of going to online. Having a mask policy that has been implemented for at least a couple of months would make me feel better as a student, as a worker, and as a citizen. And so I would hope that you reject the pseudoscience, you reject the racism, and you stand up and you say that masks are needed because it protects our citizens and our businesses alike. So please stand up against the pseudoscience and pass this resolution.
Thank you.
Okay, Mayor.
One more. One more.
Sorry.
One more. And that's it.
Hello. My name is Brandy Solomon, and I live in Ward 6. I've actually lived in Norman my whole life, so I've been in many wards. I just wanted to address the council because I am very much in support of the masks. I've thought a lot about this, but I'm very much in support of the council putting the masks in ordinance because I have 3 children that are 8, 10, and 16. And from the beginning, I don't want them to get sick, and nor do I want my husband and I to get sick. I also have friends that are 70 and 80 years old that live in our town that I'm doing this to protect them. My grandparents live in a town in Kansas with 200 people, and 17 people in a nursing home just got it. And so my grandmother has Alzheimer's, and probably, there's a good chance that her and my grandpa could get it now. And this is because people are not wearing the masks. And I just feel like, in my own opinion, if people wore them just for a month, just try it for a month, our numbers would drop drastically. We have not even tried. No one's even made the effort to try. Every time I go into a store in Norman, there's no one wearing masks but me and the kids. My kids are made fun of. They're called names. We hear people talking behind our backs. It's just, it's needed. I don't understand why everyone opposes wearing them. I understand that for medical reasons and for every other reason, I understand those. But for opinion reasons only, just try it. I don't understand, So I just wanted to give my voice. I've never talked to you guys before, so I'm new to this, but I wanted to make sure you guys knew that I supported this. And I hope that everyone understands why this should pass, and hopefully our numbers go down. Thank you.
Thank you.
Okay, Mayor, I have several email comments, and I believe Annalise also has several comments coming in off of the YouTube feed. So I will just read them one at a time. I understand that the mayor and city council are going to pass an ordinance mandating citizens wear masks. I am opposed to anything that takes away the freedoms of the citizens. You cannot force them. You guys are just making a lot of people not mad, but furious. This next one is from Terrence Doty. My friends and I are against the mandate on masks. We are tired of our mayors stepping over the bounds. We will stand up against this. We will not live scared. Melanie Ridgway lives in Ward 3. Just letting you know, I'm against the currently proposed mandatory mask initiative. I am in favor of approving the SRO grant to be used for school officers. Thank you in advance for listening to your constituents. Alice Young, I would ask that you consider our liberty versus our safety, as well as personal responsibility. Our liberties and rights should not be restricted at their perceived notion of safety. When restrictions such as these are placed there, it is never a return to the past, and restrictions only continue to mount. Truthfully, automobiles are a much larger safety threat to society than COVID-19 will ever be. Who is to say that in 10 years, the next argument will be that we must limit the right to drive and have no transportation because of risk it causes to others? I know this seems far-fetched, but 10 years ago, if anyone would have said that mandatory requirement of face mask was only 10 years away, it would not have been believed. The other issue is personal responsibility. Just as one group can choose to go out if they feel safe, another group can choose to stay home if not. This is how all risks work. It is our freedom and personal responsibility that allows us to decide how we want to handle the situation instead of being forced. My business is in Moore, even though I live in Norman. If Norman chooses to pass this mandate, I will not patronize Norman establishments and instead choose to go to Moore where there are no restrictions. Because towns right next to each other do not have the same restrictions, a mandate like this will simply hurt the businesses and economy in Norman, just as it did earlier this year with the hairstylist. I take this issue very seriously and truly believe that it is something I must stand up for. Our forefathers fought to ensure that we had liberties and freedom, and I believe it is my duty to stand up and protect what they strongly fought for. Please vote no to these kind of mandates and restrictions. Thank you for your time. The next letter is from Wendy McMahon. I may be pronouncing that wrong. McMahon, there you go. This says she's a resident of Ward 3 and writing regarding the upcoming city council meeting, including the proposed mask ordinance. I watched part of the study session last week. I have the following questions regarding the proposed mask ordinance. What was used for drafting of the proposed mask ordinance? If another city's ordinance was used, which city or town? What is the current hospitalization and ICU capacity percentages for Norman and Cleveland County? We've been given numbers of hospitalizations, but I have not heard the available capacity percentage. Concerning the requirement that children 6 and older wear a mask, were any early childhood professionals consulted to determine what impact such a requirement would have on children of such a tender age? If so, which early childhood professionals were consulted? If the mask ordinance is approved as written, would children 6 and over enrolled in private schools or child care facilities be required to have children wear masks? So much of learning in kindergarten and first grade is social, watching others' responses, expressions, and interactive. Children at this age are still learning to communicate by body language, expression, and spoken word. It seems so far-reaching and overbearing of an ordinance, which there are studies that suggest children may not be as contagious as adults, even if they have COVID-19. And then she references several studies and suggests that the age under the age of 10, as in Texas, would be a more appropriate age. How will the city impose such a mandate without negatively impacting lower socioeconomic individuals and neighborhoods? It seems that such an ordinance could impose barriers to those who cannot afford masks or have access to masks and create fines, which could exacerbate their issues. When I was at Walmart this weekend, a small box of disposable masks cost around $18. With demand being so high, the prices have gone up. If you barely have money to pay your rent, how are you supposed to have a budget to make a budget for masks so that you can go to the gas station or grocery store? The ordinance states businesses should provide the masks free of charge if the city provides them. How does the city plan to supply masks to the businesses? Is there an estimated cost? Also, how much would be the least amount one would pay if fined for not complying? I realize there's a range of charges available, but wondering how much an indigent or low-income individual would be charged. I support taking wise, controlled measures to support a healthy city. However, this ordinance is incredibly broad, while also being incredibly restrictive. The only finding of fact that details why such a broad mandate is necessary just generally states the increase in cases, not deaths, is due to the gathering of people in close proximity, including church services, bars, restaurants, pool parties, weddings, and funerals. What size are these gatherings? Are there details on what other factors contribute? In summary, what research of our specific city cases has been done to make sure the ordinance is as narrow as possible to still accomplish limiting the spread while not being overly restrictive of living life? The way the ordinance currently reads, I cannot even ride in my car with my sister, a different household, without wearing a mask or being subject to a fine. I do believe that continued education and encouragement would be a better approach for mask compliance than a mandate. If a business has a sign asking you to wear a mask, I'm happy to comply. If you disagree and decide to vote in favor of the proposed mask ordinance, I ask that you amend the proposed ordinance in accordance with the comments made above. I appreciate your time. And that comes from Wendy Hill instead of McMahon. The next one is, and I don't know, Mayor, if you want to kind of wait till the end and answer some of the ones that actually have questions. I just have a few more to read. The next one from Michael Graff. I support making it mandatory to wear masks when out in public in Norman. I recommend carefully considering what exemptions are in place for people with any form of medical condition. The ADA guidelines require businesses to provide reasonable accommodations to those with disabilities. This does not mean the person with a disability can put others at risk, nor can they be exempt from laws due to their disability. For example, a disabled person cannot drive a car without a license, or drive on the sidewalk, or park in the middle of the street. A disabled landlord cannot choose to skip safety of their tenants due to their own disability. Reasonable accommodations for a business in a pandemic would be to offer curbside pickup of items or home delivery at a reasonable cost. It is not reasonable to allow someone without a mask in their business just because that person claims some condition. In fact, it is unreasonable to believe someone with a condition cannot spread this illness to others due to their disability. The ADA has put out a statement much to this effect. He cites the URL for that, and then he summarizes it by saying the ADA does not provide a blanket exemption to people with disabilities from complying with legitimate safety requirements necessary for safe operations. He also references a Facebook post that where someone is stating, all you have to say is you can't breathe when wearing the mask and you're exempt. They can't prove otherwise. This is from Matthew Cooper. Dear City Council, it should not be expected nor invited to impose on the people a more drastic infringement of their freedoms. Our response as a community from the onset of COVID-19 pandemic should be to err on the side of freedom, but instead we continue to impose restrictions on the community as if they were unable to determine for themselves the best course of action. The city's current response should be to educate the community on the facts and the data of the pandemic so they can be well informed as the pandemic continues. The right to move about freely in the public is one of the cornerstones of American democracy. Benjamin Franklin once said that those who give up essential liberties to purchase a little temporary safety deserve neither liberty nor safety. My name is Rebecca Punto. I am a Norman resident. I'm also a registered nurse at a large hospital in Oklahoma City. I'm writing this email in hopes that it will be read at tonight's special session. Healthcare experts across the world have encouraged everyone to wear a mask or face covering in public spaces, in addition to social distancing, good hand hygiene, and staying at home when possible. Unfortunately, the voices of our health experts and leading scientists have been drowned out by a sea of misinformation and public outrage. The science has proven over and over again that these measures work. Many other countries, states, and cities have adopted these measures and they have worked. It is also unfortunate that when many people, particularly Norman citizens and Oklahomans, are presented with the facts, they choose to disregard them. At this point, people having the freedom to make a choice about whether or not they will wear a mask in public has gone too far and has become dangerous. Many people choose not to wear a mask in public for whatever reason they have, and it is time for our local government to step in and put an end to this blatant disregard for others. Wearing masks or face coverings protects other people from whatever droplets the wearer may be spreading. Masks need to be mandatory in public. Wearing a mask is how you show your fellow Norman citizens that you care. Wearing a mask has no adverse effect on the wearer whatsoever. Most, if not all, healthcare facilities are requiring every employee to wear a mask. Nurses like me, doctors, and other healthcare staff are wearing masks for 12 plus hours at a time with no adverse effects. I believe it is not too much to ask Norman residents to wear a mask for 1 hour while at the grocery store. I would also like to paint a realistic picture of our local healthcare system. Norman Regional Hospital is a well-equipped medical facility. However, many critically ill patients are sent to Oklahoma City area hospitals. Currently, Oklahoma City area hospitals are near capacity in their intensive care units and regular medicine beds. The more patients that become hospitalized for COVID-19, the less resources available in our healthcare system. If Norman Regional becomes overwhelmed with patients, where will the patients go? If Oklahoma City hospitals are at capacity, where will they go? My biggest fear as a nurse is that we will start to lose many Oklahomans from survivable car accidents, survivable heart attacks, survivable strokes, and survivable illnesses because we will not have enough resources to provide adequate health care. Please pass this mandate. The health and safety of Norman residents and Oklahomans are in your hands. From Mrs. Cole in Amanda Cole in Ward 8. Will you be providing masks if you pass the mandate? When can we pick those up? Will you be delivering masks to the homeless and the poverty stricken? If the point of controlling the virus was to keep from overwhelming the healthcare system, can you clarify how many COVID patients and separately ICU COVID patients are currently in Norman hospitals? Where will the biohazard containers for disposing of these masks be located? Do you have a team in place for ever cleaning up the ones already laying around town? Will people be doing jail time for this nonviolent ordinance violation with real criminals are released to make room for them? What's your plan for the increase of illnesses whenever you eventually go back to allowing normal freedoms? The increase of every contagious illness due to stopping regular immunity buildup during this time. What purpose did the survey serve since it was open to anyone on the planet? Are you suggesting that I put a mask on my 3-year-old? Will my autistic teen be ridiculed and harassed for not wearing a mask, as if these kids don't already have enough problems already? How are you preparing for the loss of students and funding of NPS as so many move to other schooling options? Are you trying to say I can only protest during certain hours of the day? Is that legal? According to the CDC, based on death certificate data, the percentage of deaths attributed to pneumonia, influenza, or COVID-19 decreased by 9% during week 25 to 5.9 during week 26, representing the 10th week of declining percentage of deaths due to PIC. If the percentage continues to decline, it is likely COVID-19 will lose its classification as an epidemic in the next few weeks. So why are we discussing masks into November? The next one is from Alexa Thomas. Good evening, Council. Thank you for your hard work, especially during these unprecedented times. I believe it's time to mandate masks for all citizens partaking in activities within the community. However, a mandated mask intervention will not prove effective enough at maintaining our numbers of active cases due to the community spread from this point forward. It is past time to reinstate a previously recognized effective intervention from the Healthier at Home initiative. It is time to go back to phase 1B, as the graphs represent phase 2 to be ineffective. Decisions for phase changes should be based off of the decreases in the cases instead of phase changes based on available beds within nearby hospitals. As this shows a criteria of active cases to achieve or maintain versus a decreasing trend of active cases. The changes we make with intervention should be to decrease the lifespan of the virus within our community. We do not have to make public health decisions based on managing someone we can take control over through an already proven effective intervention. We should not wait until we have an unmanageable problem at our hands to attempt to reinstate another plan to be utilized in addition to requiring masks. By incorporating this previously proven effective plan, we can recognize that intervening and not solely managing community spread to be more effective and least intrusive to allow for the freedom of people, as while establishing and decreasing trend line with the graph. This will allow businesses to stay open long-term and help with addressing the economic crisis threat that is already occurring elsewhere that may occur here as a result of having to reinstate futuristically another stay-at-home order to achieve our long-term goal at decreasing daily COVID cases within Norman city limits. This will allow us to not have to reverse to a stay-at-home order as a result of neglecting the need to reverse the phases on this date within the Healthier at Home plan. While the opportunity to address it has occurred, the time is now to change the phase of the intervention as we, as a city, undergo, as well as mandate required masks to be worn by the public. This is from Barry Durham. I oppose this. Oh, never mind. Sorry, that was something else. This is from Jerry Davis. I was born and raised in Norman. I've lived here for 32 years and I work as a bartender here in Norman. I commend the work you all have done during the pandemic. I have a couple of concerns about this ordinance as well as the order of the business for the July 7th meeting. Why is the mask ordinance being voted on before the new members are sworn in? With all respect to Council Members Scott and Scanlon, it is right to allow them to vote on an important ordinance right before leaving office. Is it right to allow them to vote on an important ordinance just before leaving office? Just curious about why this specific order. Now, as far as the mask ordinance goes, the bar I work at has a demographic of a typically 30s and older crowd. We are not a college bar. My concern is that if the ordinance passes, that I would be forced to become the mask police at work, potentially opening me or other coworkers up to violence and threats by those customers who refuse to wear the masks. We all heard the stories about Stillwater trying to require masks and then a day later removing the ordinance. Also, the provision that bars and bar areas and restaurants closing at 10 or 11 is concerning because I feel that the bars in Norman will be losing a vast majority of business to other areas, casinos, Oklahoma City bars, etc. Spending money and taxes for other areas not in Norman, potentially exposing themselves and still coming back to Norman to spread illnesses around. Thank you for your time. I wish you the best with your vote tonight. From Barry Dunham, excuse me. I'm voicing my opposition to the mask ordinance. Please consider the potential loss of business, sales tax revenue, and discourse this will cause. Please take more time to study this. It seems that council has only considered opinions that bolster their preconceived agenda to voice this upon our citizens. You have no effective way to enforce this ordinance. Please do not burden our police with this task. This stands to pit citizens against one another. Please consider that although there is a spike in COVID cases, the death rate has steadily declined. Respectfully submitted. The next one's from Alexandra Penner. I ask you to please vote yes for the citywide mask ordinance. COVID is easily spread and other deadly. Mask wearing is absolutely vital to slow the spread of the disease. Opponents of the ordinance have argued that masks cannot be mandated because of people with sensory-related disabilities being unable to wear them. I am a person with a sensory disorder, and I wear a mask whenever I leave my house, even though it is a bad sensory experience because it is the right thing to do. Even if I couldn't, the ordinance contains a carve-out for people with disabilities who actually can't wear a mask, and if it didn't include an exception, services like curbside delivery are sufficient accommodation under the ADA. Please do not let people use my disability as an excuse to determine public health. The real way to ensure disabled people have equal access in Norman is to require masks to protect this immunocompromised and those with underlying cardiovascular conditions. From Holly Gray, if I am outside walking my dog, say Lions Park or another public place or trail, it is very easy to socially distance myself from others. Or if I'm at a kid's soccer game at Gillis or Rother Fields, where you can easily sit 6 feet away from others, it appears as the ordinance is currently written that I would get a fine from walking outdoors without a mask. That seems a bit extreme. Is the alteration of that mandate a consideration? Hello, my name is Jake Allen. I currently reside in Ward 4. I also work on Campus Corner at a restaurant that currently does not require customers to wear masks. One of my coworkers has now tested positive for coronavirus. This has put me at risk as I have asthma. This has put my roommate's grandmother at risk. People are being forced to work in unsafe conditions because businesses are not requiring masks to be worn by customers. Those concerned for their health cannot simply stay home. We have to work. If people don't believe in the efficacy of masks, then they are free to endanger others' lives at the moment. There's no harm in wearing a mask. I'm asking that the council support a mandate for masks to ensure the safety of all people at greater risk of being adversely affected by COVID-19. From Myrna Tinsley, for the mental and physical health of some senior citizens, it would be helpful to not require a mask for some outside activities such as golf. Anastasia Woolsley. My name is Anastasia Woolsley in Ward 6, and I am emailing to comment on the mask ordinance. I work in healthcare and have been exposed to COVID-19 on a daily basis. One thing I have noticed working in healthcare is that there are two types of masks, those that protect the wearer from spreading the virus and those that protect the wearer from contracting the virus. If the public doesn't understand or know the difference in types of masks, then mandating masks won't reduce the spread of the virus if the public is wearing the wrong type of mask. Norman needs it. Oh, okay, never mind. I'm sorry, that's all of that one. From Holly Gray, how was the November date selected? Shouldn't this be reviewed on a more frequent basis as the science and data behind the virus progresses? Scott Dixon, how many COVID patients currently in Norman Regional Hospital? How many ICU and regular beds? What's the 7-day rolling average of COVID patients in Norman Regional? What's the most patients utilizing Norman Regional beds due to COVID? From Michelle Trizzle, why can't the mandate be for only 30 days instead of for 4 months? From Justin Cure, the hours for bars and restaurants need to be changed to pre-COVID hours. What makes the hours after 10 or on the weekends and 11 on 10 on weekdays and 11 on weekends more dangerous than 6 p.m. any day, especially if there is a mask ordinance and social distancing? We need to support our restaurants and bars and let citizens decide if they want to patronize an establishment after 10 p.m. From Ryan Robinson, how are bars defined for the purposes of this ordinance? Bar areas of restaurants should close at 10 p.m. on weekdays and 11 p.m. on weekends. What constitutes the bar area of restaurants, and what does close mean? From Brian Burkhart, how is the mask mandate going to have the desired impact given that hundreds on this live chat feed are saying they plan on claiming health conditions if any person can claim a health exemption, regardless of whether they actually have one, and it seems that all the anti-maskers in Norman are planning to do so. Isn't the mandate as written pointless? From Holly Gray, will we be able to monitor private parties across Norman if bars are closed? College kids will just go elsewhere to socialize. Isn't it better for us to be able to manage capacity at our bars and restaurants than for them to just congregate at homes and apartments? From Daniel Munson, leadership by example is important. Will the City Council make a pledge to the citizens of Norman that you will follow all federal, state, and city COVID ordinances and will be willing to tender your resignation if you're caught recklessly violating that pledge? From Bianca Gordon, oh, never mind, sorry. From Alexa Thomas, many individuals who have autism and other neurodiversities have difficulties with sensory issues as well as social issues and cannot identify the social importance of wearing a mask as well as behaviorally tolerant wearing a mask on their face. Many individuals in therapy have difficulties tolerating wearing certain clothing, and various other toleration protocols are taught within treatment as well for similar reasons. Is there any way we could address this within the mandate of who is and who is not required to wear a mask? I know individuals with autism and other neurodiversities who have been successful with tolerating wearing a mask up until now. However, having been a therapist for a number of years and working solely on toleration skills, I know this will not work for many others of these individuals, as well as those that are older than the age of 5. From Sarah Wormker, my name is Sarah and I live in Ward 4. I want to express my support for this facial covering ordinance. I have 1 kidney and this ordinance will protect my health and the health of my loved ones. This is from Christina Otis. I fully support mandating masks in Norman, and I think we need to listen to the overwhelming scientific and medical evidence and do what is right for the safety of all. Furthermore, we need to condemn the racist and hateful language of Chinese flu. And now I will turn it over to Annalise. Annalise, are you ready? In her office. Here she
Sorry
is.
about that. I had to just unmute myself there. All right. Cameron Bean, Ward 6, no mask. Kristen Houston, no mask, please. Please allow us to use our discretion. Ward 6, if passed, we will be shopping elsewhere. Amanda Wilson, Ward 1, no mask. Karen Bean, Ward 1, no mask. Heather St. Dennis, Ward 3, no mask mandate. Michelle Trissel, Ward 5, absolutely under no circumstance do I agree or support this mandate. Phil O'Neill, Ward 1, yes, masks. Bridget Roberts, Ward 8, how would people who can't wear a mask and decide against the face shield go about providing such as they do so they don't get fined? I am against the mandatory masks. Megan Strawn, Ward 2, I am strongly in favor of the mask ordinance. The science is clear. A mask ordinance will help protect our entire community, specifically our most vulnerable. Ginger Welch, Ward 4, no mask. Erin Jeffries, Ward 3, America will never be out of this pandemic until we reach herd immunity. So the sooner the better, like many other countries have. Yes, more cases, but they are recovering fast. Let people decide for themselves if a mask is right for them. They decrease O2 stats, create unsafe air to breathe. Most people do not even wear them correctly to be effective. New COVID-19 infection rates for our city, Norman, is 0.00005 or 1 in every 100,000 people ratio. Travis Starling, Ward 8, I support the mandatory mask ordinance as a matter of public health and safety. I am concerned that the Norman Police Department is being given too wide a latitude to enforce the ordinance and would encourage council to consider deleting similar offenses from 11-1106A. Kat Curry, Ward 6. Can council explain whether or not there are measures in place that will ensure that lower income and other populations will not be disproportionately affected by the mandate? Jennifer McCorkle, Ward 3, no mask. Alexa Thomas, Ward 8, keep your disease to yourself. Wear a mask. Yes on masks. Pennsylvania requires masks for all. California has many cities requiring masks for all, where the best public health universities reside, and pushed out the original research we had as the USA. Pennsylvania requires, I do not want to be subjected to potential death because you can't cover your mouth with a piece of fabric and take care of your health, and therefore take care of others. Yes on masks, masks for all. California has many cities requiring masks for all, where the best public health universities reside, and pushed out. I think I repeated there. Melissa Caperton, Ward 6, yes to masks. Andrea Howard, Ward 3, no masks. Kate Anderson, Ward 1, we absolutely need the mask ordinance to keep our community safe and prevent unnecessary deaths. If you enter a public space without a mask, you are endangering the lives of everyone around you. Alice Youngward, Ward 5, no mask. Don Burks, Ward 8, I think masks and distancing ordinance is a great way to prevent the need for another shutdown. Rhonda Robertson, Ward 2, herd immunity is built up by being in a group. No. Kendra Wesson, Ward 3, scientific reason is the election. Tammy Dodson, Ward 8, there are several people I know that have false positives. So what is the percentage of false positives? Lori Richards, Ward 1, yes to masks. The virus is awful and can kill people who in their right mind wouldn't support trying to stop it from killing people. Michelle Sloan, we need masks, Ward 6. Damon Hinkle, Ward 3, no masks. Aaron Jeffries, Ward 3, question for Alice Patron. What is the end game? Vaccinate everyone, achieve herd immunity. I believe number 2 is our goal. Therefore, this mask provision only delays the goal. Madison Brickman, Ward 2. Vote yes. It is next to zero effort to wear a mask in public, and it may keep numbers down and steady, giving hospitals time and resources when both are needed for COVID and non-COVID patients. Mary Francis, Ward 7. Almost all states have endangerment laws. The federal government does. Also, please vote for mandatory masks. Hannah Smith, Ward 1. Annalise deserves a medal for keeping up with this comment section. Thanks, Annalise. I'd say thanks, Brenda, too. Adrian Johnson, Ward 2. I'm okay with wearing a mask, but what will be put in place for people racially profiling the several blacks wearing them? This is a whole other issue. Brent Jewell, Ward 6. As a person with severe asthma, I can tell you that wearing a mask did not cause me any problems. The best mask for asthmatics should be surgery masks or N95 masks. Doug Harris, Ward 4. How can one be punished for legislation for being punished being legislation has not made this a law. Also, why give police more to enforce? They have enough since defunding. How can one be punished? Jonathan Williams, Ward 1. Vote no, my choice. Austin McDonald, Ward 7. Do what it takes with masks. A new stay-at-home order is not an option, as it would push OU all online, leading to deportation for international students. Taylor Gamble, Ward 1. COVID will shut down small businesses if we don't prevent it from spreading at these locations. Protect retail businesses. Protect our paychecks. We are the front line. Protect us. Selena Lautzenheiser, I apologize. Lautzenheiser, Ward 6, vote yes. Brent Jewell, Ward 6, my autistic daughter wears a mask while doing her shopping job. She has sensory issues. Do not use people like her or people with respiratory problems to say no. Thank you. Christy Phelps, Ward 6, please vote yes to mandate masks. Thank you for the exception provided for intense outdoor exercise. Thank you for working to protect our citizens' lives. Nicholas Harper, Ward 1, allowing businesses to create their own mask policy can solve a lot of these issues. Ayan Zahidi, Zahidi again, I apologize. Zahidi, Ward 1. I was wondering if you guys would consider bring a doctor to your Zoom calls because most of the people in this chat don't know what they're talking about. Ward 7, Destiny Garner. If masks are useful, why limit hours and still have social distancing in place? Why not encourage takeout and staying at home again? Save small businesses. Lauren Brown, Ward 6, mask mandates are ineffective, dangerous, unconstitutional contradictions that jeopardize our life, liberty, and pursuit of health and happiness. Davina Welch, Ward 4, no. That's all.
Okay, Mayor. That ends the public comments. You do have a couple council hands up. If you want to go there next.
Well, first of all, I want to thank all of the residents for sending in your comments. We really appreciate you engaging in this important meeting. In terms of council comments, would it be helpful just to dive into the amendments that we know are coming so we can move forward a bit? Head nods are fine. I'm looking around.
I call the question.
Who said that?
Okay.
Well, first of all, might have to take a bathroom break though before we get into that.
That is a good point. I support a 5-minute break before we dive into the amendments.
Can I first just say we have doctors here that I have one question for that I think will answer a lot of the miscommunication on the feed, and they hung around, and I don't want to make them wait any longer. If we're going to be going into the amendments and then voting, I think we can probably let them go. But with permission, I have a question that I think will help answer some of this issue with the hospitalization rate and not jiving with the case rate.
Dr. Cook.
Okay. So whether it's Dr. Cook or Dr. Raskob, whoever would like to answer it, can you talk a little bit about lead time bias and how early detection of cases, which we're doing a little bit better on now than we were early on in the pandemic, can address kind of this discrepancy between the drastic increase in cases, but not yet a drastic increase in hospitalizations?
Yes, so I think what we saw at the beginning of the pandemic was that testing was so limited that only people with severe illness or who are requiring hospitalization got tested. And so we did see this increase in deaths that was shortly after an increase in cases. Now we do have early detection with early testing and more availability of testing even for mild disease. So we do see an increase in cases that precedes our increase in hospitalizations and deaths. So I do have strong concerns that what we're seeing right now is an increase in cases in younger people who are generally healthier. Once that spreads inevitably to the other people in the community who are more vulnerable, we will see an increase in hospitalizations and deaths. So I think the fact that we're focusing on the lack of a big rise in deaths at this point should not be driving our decisions to try to prevent getting to that point shortly after this spreads to other vulnerable people.
Thank you. I didn't know if Dr. Raskob had anything to add, but I want to thank you guys for your time and for sitting with us through all of this. And I really appreciate your feedback and your insight.
Thank you.
All right. Well, again, much thank you to the doctors on the call. I appreciate your time and multiple visits to these meetings and participation in the emergency management meetings. We do make science-based, data-driven decisions here in Norman, Oklahoma. And I'm always happy to defer to the experts, and I appreciate all that you do. So we will take a break. Judge Nichols, I'm going to give you a shout out for hanging in there too. We will get to your part soon, I promise. Okay, with that, everyone, it is 9:30, 9:35. We will resume this meeting.
Okay.
Keep their cameras on.
I know.
You are.
Fun.
All right. Is everyone coming back? Looks like Councilmember Scanlon's got a snack. We're gonna make it through. Okay, let's see, wards 1. Where's Carter? We will wait on Madam Clerk, who's steering this ship at City Hall.
We're gonna start if you guys.
I'm ready. I think everyone's here.
Okay. We are all here, back in service. You have a couple of hands
I
up.
would like to.
Oh, go ahead. I'm sorry.
I was going to recognize Councilor Patron. You're muted.
Okay, I was gonna offer an amendment, sorry. Okay. I got way too many electronic devices going on here.
Okay, well, if you need a minute, Councilmember Holman, did you have a question for our doctors that are still on the line?
Oh, sure, yeah. I would really, maybe if they would like to address some of the comments that we heard or some of the questions that we heard about data. Just some of we heard a lot of comments and questions. I know we can't answer everyone, but maybe address some of the ones that stuck out and maybe clarify maybe some of the misunderstanding we might be seeing out there.
Yeah. So there is a misunderstanding, and I don't know, Brenda, can I share something with the group on the screen if I share?
Sure.
Okay, let me just show you one thing that I think can clear up. I'm just going broadly from what was discussed, and this follows on what Dr. Cook just mentioned prior to the break. So this graph shows, the bar graphs are the number of tests, PCR tests for COVID we've done in the state during these weeks, okay? And the red line shows the percent of those tests that were positive or cases detected. And you see back here in April, we were doing only about 17,000 tests per week. We were running about a 4.9% positive rate. As the number of tests increased, the positive rate actually went down because we were testing many people who didn't have symptoms or had a low likelihood of having the condition. And so our positivity rate went down as we ramped up testing. Here we saw a little decrease in testing between May 17 and June 14. And say for a few weeks, May 25 through June 14, we're running around 30,000 plus or minus tests. But now we're seeing positive rate or the number of cases climb right up. This graph is very clear. So, and we're now, as of here, up to 7.2% of tests were positive. Now we've seen a spike in some testing here. So what's clear is we're finding more cases. As Dr. Cook mentioned earlier, so the number of new cases is not just because we're doing more testing. We're having a higher number of cases when we've had similar or less testing, okay? The key thing is that many of these cases, half of them at least, are 18 to 35-year-olds who aren't getting sick and not needing hospitalization, mostly, right? The people who are getting sick are mostly 65 or older or with underlying medical conditions who go in hospitalization. Now, these people, though, will then be spreading it to others who are more vulnerable, who are then requiring hospitalization. But that occurs with a lag time of anywhere from 2 to 4 weeks. So as the people with milder conditions are detected, but then spread to others, and we get a spread of more cases, we get more vulnerable people being infected who need hospitalization. And so if this is the data for hospitalizations for the state overall, here's where we were back at the peak in April 7 to 9, when the safer at home initiatives and other things were brought in. You see there was a decline in hospitalizations, very significant decline. And now we're seeing as more cases are occurring and we're increasing the spread of the virus in the community, hospitalizations are climbing quite significantly. Now, there's still quite a bit of capacity within the state, although you've heard different comments tonight. There was one of them from a nurse in Oklahoma City, and Dr. Cook's told you about Norman. Our goal is not to wait until the hospitals are at full capacity before we act. That would be a problem. What we're trying to do is prevent the increasing spread of the disease from overtaking the capacity of the healthcare system to deal with people who are very sick. And that's the critical point. And that's what you're trying to do with this mask. You don't want to get to the point where the capacity is full and the doctor has to say to someone who comes there, I'm sorry, we just don't have the capability to save your loved one or to treat them with a ventilator or whatever, right? So we need to intervene before we get to full capacity. That's the whole point. And there's a lag, as was discussed, of weeks before, because the incubation period is 14 days. Most people will show symptoms by 5 to 7. The reason, the other comment that was in the general public is, if we take the mortality from everybody infected, symptomatic and asymptomatic, of course it's very low because it's lower, right? But the asymptomatic people that we can find if we test them, they don't go to seek healthcare resources. They're not consuming use of hospital beds and ICU and so on. Among the people who present to a hospital or a doctor, the case fatality is still in Cleveland County, 3.5%. And so this is about the subgroups of people who are most vulnerable, and those are the ones who need healthcare, who need the hospitalizations. That's the over 65. That's those groups with underlying conditions, particularly diabetes, hypertension, heart disease, lung disease, so on. And that's very prevalent in Oklahoma. And if we just let this continue to spread throughout the community, you're going to exceed the capacity of the healthcare system in time. It just lags by weeks to whatever period of time. But we're on the trajectory to be like what New York was like unless we intervene.
Okay,
Thank you, Dr. Raskob.
If Dr. Cook, if there's anything that she wanted to add or not, I think that kind of addressed a lot of what I heard.
I agree with everything he said.
Okay. So this one might be for Catherine, a question for Catherine Walker. So one of the questions that just maybe would clarify, I heard someone say you can conceal carry while wearing a mask, but you can't open carry while wearing a mask. What would be your opinion on that? I think it applies to in the commission of a crime regardless. I think that's the key phrase, but please, if you would offer a clarification on that.
Sure. And I pulled that up a minute ago. I think it's, yeah, the statute that is talks about wearing a mask talks about wearing a mask that conceals the identity of a wearer during the commission of a crime or for the purpose of coercion, intimidation, or harassment. Then it has some exceptions, Halloween and parades and such. But here, with these masks, these are not going to be worn. It's not intended that they'd be worn during the commission of a crime or for the purpose of coercion, intimidation, or harassment. It's to fulfill the purpose of public health. So this statute would not apply to this ordinance.
So people that want to open carry their weapon, which is allowed by Oklahoma state law, can do so while wearing a mask without risk of being stopped by the police or cited or having their license taken away, as long as they are not committing a crime.
Correct. I don't know of any restriction on wearing a mask specific to carrying a gun if you're not committing a crime.
Okay, I appreciate that. The penalty range, would you mind talking just a little bit about why it's $50 to $500? Why that range? Just so everyone can have a better understanding of, it's not really an arbitrary number. There's a reason behind it.
Sure. So Oklahoma state law restricts municipalities in the maximum amount of fines they can impose. And so what you typically see in our ordinance for a non-traffic offense that's not an arrestable offense is $50 to $500. That's the range for the penalty. By the time it gets to municipal court, we will, in this case, have educated, warned, and then there might be a citation, which would subject someone to the fine. It doesn't have to be $500. It doesn't have to be $50. It's typically in the discretion of the prosecutor to make the recommendation to the judge, and in the discretion of the judge to impose the fine based on the circumstances.
Okay. And will people on the golf course be required to wear a mask while they're golfing?
I think the exception for exercising or walking in communal outdoor spaces, if you can maintain social distancing, would apply there, so that they would not have to wear a mask as long as they're social distancing.
Okay. That's the only questions I think I have right now. I'll have some stuff to add on amendments that may come up, but that's all the questions I have right now for staff. Thank you.
Excellent. Let's dive into amendments, shall we? We do have 3 amendments that were presented, and so I would like to recognize Councilor Patron.
Thank you. Okay, so in some of the whole lot of phone calls and text messages and emails that I've had, this one comes from that. And so it's, I have a business owner that lives in the ward, and they are very supportive of the mask ordinance. However, they have a family member that is extremely high risk, and due to the threat of COVID, they haven't been able to spend much time in the business, and haven't been there during operating hours at all. They just go in at night to deal with bookkeeping and all of that, because so many people, they haven't had an ability to enforce a mask ordinance. So the frustrating part for it is that while they have been able to not be around the public themselves. The public is coming to them at their home. And that is really unfortunate when you're trying to be that person that says, you know, they've been told if you can't, you know, if you're high risk, stay home. Well, they are staying home and getting door-to-door contact. And then I had another one that business owner that had to do with drive-throughs. And so as they read it, neither of those things seemed to be covered. So number one, I move to amend subsection D of section 3 of the ordinance as follows. D, public setting means any public space, any public place where persons congregate, which is not a place of public accommodation, including without limitation offices, workspaces, houses of worship and ancillary facilities, childcare facilities, hospital and health facilities, gymnasiums, and physical fitness facilities, adult and youth sports facilities, comma, places and situations where in-person contact is made at the door or window in residential or commercial settings, comma, communal outdoor spaces such as sidewalks, trails and parks, food trucks, and other outdoor retail entities. So the point is that if you're going to go door to door, whether you're selling windows or doing whatever it is you're doing, you need to be wearing a mask. If you're going to go through the drive-through, it's not just the drive-through worker that would be masked. We're not, you know, we're protecting the worker as well from the public. So can I get a second?
Second.
There you go. You got lots of seconds. Are there any comments from council regarding this item? Madam Clerk, I'll let you call on people if there are.
Well, we had Councilmember Bierman.
So I have noticed this happening quite a bit more in my neighborhood in recent weeks. Window sales, alarm system sales, and a lot of people thanking the employees at our drive-through business for being masked because they were not seeing that with regularity around town. So I appreciate this amendment. My hope is that people won't be out there all that much because it's going to be so darn hot for the next week or so. But I do think that it's important to protect our vulnerable residents who are trying to stay home and maybe expecting packages or deliveries and then open the door to find someone who is unmasked trying to sell them something. So I appreciate this amendment. I'm happy to support it.
Okay, Councilmembers Holman and Scanlon have their hands up. I'm not sure if it's to this amendment or something. Okay, Stephen or Councilmember Holman is to this amendment.
Maybe just clarification from either Catherine or Councilmember Patron. But just to be clear, this is aimed at door-to-door sales. And are we saying someone that goes through a drive-through at fast food, the person in the car would need to wear a mask when they go to the drive-through? I'm not sure I was clear on that exactly, but just to, maybe just a clarification on what all that means.
It's aimed at, for the first part of your question, it's aimed at any door-to-door contact. So whether or not it might be for religious reasons that you're going door-to-door, it might be for selling a termite plan, it might be Anderson windows every day.
Campaign season?
Say that again?
Campaign season?
Campaign season. Whatever the reasoning is, it's important that we're not, the people who are really intently trying to not go into the public need to be not having the public come to them and subjecting them on their doorstep. Especially a lot of people don't have storm doors and they might not have peepholes, so they don't know what's on the other side of that door. It needs to be a masked person, and so, or facial covered, let's put it that way. And then for the second prong of your question, it seems, according to these business owners, it's that, you know, the people might wear masks when they come into the store and take food to go, or into the restaurant, into the bar to get there to go, but they're not wearing it, when they actually go through the drive-through and subjecting that particular worker to car after car after car of people not wearing a mask. So if you can have a mask in your car and just put it on really quickly when you go through the drive-through, then because you have to pull up so closely to the window that you're not socially distanced. So the idea is that that worker as well, that's making $8 an hour and probably doesn't have medical insurance, isn't then turning around and giving it to the rest of the store.
Okay. I appreciate the clarification. Thank you.
I don't see any other.
Councilmember Scanlon.
I don't think he wants to talk to this amendment, Mayor.
Oh, okay. If there are no other comments, I will add that I support this amendment because I had that experience the other day. I'm on the phone. I didn't answer the first time. He kept ringing. I thought it was an emergency and it was someone trying to sell me windows with no mask on right at my front door. So I fully support this amendment and thank you, Councilor Patrone, for bringing it forward. Okay, if there are no other comments from council, the motion on the floor is to amend subsection D of section 3 of the ordinance to add places and situations where in-person contact is made at the door or window in residential or commercial settings under the definition of public setting. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Carter.
Aye.
Councilmember Patrone.
Aye.
Councilmember Hall.
Aye.
Councilmember Wilson.
Yes.
Councilmember Scanlon.
Yes.
Councilmember Holman.
Yes.
Councilmember Scott.
Yes.
Mayor Clark.
Yes.
The amendment passes unanimously.
Thank you, Madam Clerk. I would now like to recognize Councilmember Bierman for another amendment.
So this amendment aims at shoring up some of the ADA exemptions that we include in this ordinance and also requiring businesses to offer alternative accommodations and further specifying them to include online ordering and delivery services. So I move to amend the last paragraph in subsection C1 of section 4 of the ordinance as follows. Persons exempted under subsections 1, 2, and 5 of this category shall consider the use of a face shield provided the shield wraps around the sides of the wearer's face and extends to below the chin. Additionally, options such as carry-out, curbside pickup, and online ordering and delivery services, when available, shall be considered to avoid coming into close contact with others outside of their household.
Do I have a second?
Second.
Okay, are there any comments from council regarding this amendment or questions? Councilmember
Yes.
Holman, is that a?
Yes. So I heard the phrase where possible, but so I just want to clarify with the delivery issue is that one type of business, dispensaries, are actually prohibited by state law from delivering. I don't know if that needs to be clear or if that it would be covered under the where possible or so that would be my only question on that one.
I'll send that over to Catherine, but that is my assessment of providing that additional phrase is to allow for that kind of flexibility where it is either not legally allowable or not a business is not able to do it.
Thank you.
Yeah, that's correct. We're not, by passing this amendment, you would not be creating a new right to deliver if it doesn't exist under state law. It's really only where it's already possible or feasible.
Thank you.
Councilmember Scanlon, did you have a comment on this? Okay. I'm not seeing any other hands raised by council, Mayor.
All right, seeing no other comment from council regarding this amendment, the motion on the floor is to amend subsection C1 of section 4 of the ordinance to state persons exempted under subsection 1, 2, and 4 under this category shall consider the use of a face shield, provided the shield wraps around the sides of the wearer's face and extends below the chin. Additionally, options such as carry-out, curbside pickup, and online ordering and delivery services, when available, shall be considered to avoid coming into close contact with others outside of their household. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Carter,
Aye.
Councilmember Patron,
Aye.
Councilmember Hall. Aye. Councilmember Wilson,
Yes.
Councilmember Scanlon,
Aye.
Councilmember Holman,
Yes.
Councilmember Scott,
Yes.
Mayor Clark.
Yes.
The amendment passes unanimously.
Thank you, Madam Clerk. I'd like to recognize Councilmember Bierman for another amendment.
This is just a cleanup amendment that clarifies that a restaurant or bar that doesn't comply with the capacity limitations in the ordinance are subject to the same fine as those who fail to post the signage. I move to amend subsection B of section 7 of the ordinance as follows. Places of public accommodation that willfully fail to post signage or comply with capacity limitations as required herein may be subject to a fine of $50 to $500 or civil action as appropriate. Every day a violation is committed or permitted to continue shall constitute a separate offense and shall be punishable as such.
Do we have a second?
Second.
Are there any questions or comments from council regarding this item?
Councilmember Holman,
Maybe just a clarification, for Catherine, on what legally that means.
Sure. On this amendment, the penalty section originally just talked about failing to post signage, but then we added the capacity limitations, and this is just a cleanup to add that language into this penalty section so that it would be enforceable.
Okay, thank you.
I'm seeing no other comments, Mayor.
All right, seeing no other comments from council, the motion on the floor is to amend subsection B of section 7 of the ordinance to add or comply with capacity limitations to the list of items subject to a fine. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Carter,
Aye.
Councilmember Patron,
Aye.
Councilmember Hall,
Aye.
Councilmember Wilson,
Yes.
Councilmember Scanlon,
Aye.
Councilmember Holman,
Yes.
Councilmember Scott,
Yes.
Mayor Clark.
Yes.
The amendment passes unanimously.
Thank you, Madam Clerk. I would now like to recognize Councilmember Holman for another amendment.
This one is to address the issue of what we talked about tonight, concerns about bars and closing times. Basically, what I would like to propose is to strike the language of closing at 10 and 11. I would prefer to allow these bars to stay open with their regular hours, but with reduced capacity. I think that kind of protects our bars that are already not even getting close to that capacity, and it helps to protect us from the problem spots that we have been seeing, which would prevent those large crowds from gathering there, I think. So I don't have that written out exactly like I would like to say legally, but that is kind of what I'm getting. And I would maybe like to specifically revisit the bar restaurant issue before November 30th for sure. Maybe even the end of August to see what we're dealing with by then. So I'd be open to some discussion about this. So because I heard some other council members comment on it as well. I think we've heard quite a range of comments in regard to this specifically.
Madam Clerk, take it away.
Was there a second?
Second.
Okay.
What was the amendment?
The amendment was to strike the last sentence in subsection B of section 5, where it reads, bars and bar areas of restaurants shall close at 10 p.m. on weekdays and 11 p.m. on weekends. So that's striking that language. And now I'm going to call the roll. Councilmember Bierman.
Is it replacing it with something?
No, it's just it's taking it out of the ordinance where they would not have to close.
Do we need to clarify reduced capacity? Like I'm okay with it being reduced from what we have
That's
now.
still in there because it says they have to socially distance. So that's already in the ordinance. It already covers that. Is that correct, Catherine?
Yeah, the ordinance says that in bars and bar areas of restaurants, they need to limit their occupancy to seated areas only or seating only, and that those groups need to be sat 6 feet apart, just like they would be in a restaurant. So this is, I think, going to functionally or practically impact some bars and will reduce capacity just based on available space.
Okay.
So can I ask
Councilmember Beer. Oh, I'm sorry.
Yeah.
just so that everyone's clear, it's basically it's a prohibition on gathering, clustering up at the bar and everybody trying to order a drink there, right? You need to be waited on at your seat.
That's correct. In some areas, I know some bars have, standing room only if there's a concert or some performance or something like that. And so this would restrict those type of events to seated spaces only, socially distanced from one another.
Okay, and then what about the part where he wants to revisit it and he wants a closer time frame as students start coming back so that we can keep tabs on this one?
Oh, I didn't take that as being part of the motion. I thought he was just saying that he would like for council to look at that again.
If it needs to be part of the motion, I would definitely support putting it in there for the last meeting of August, that the council takes a look at the data then on specifically bars and restaurants.
I've got the city manager in my office with me. He was also having connectivity issues. And he'll commit to putting that on the agenda. So it doesn't have to be part of the ordinance, but we will get that back in front of council in August.
Oh, he's muted. Stephen or Councilmember Holman.
Sorry. So at that time, then the council could review the data and either increase capacity if things were improving, or look at maybe doing a closing time or some other things at that time. Is that correct? We could alter it any time is what I'm getting at.
Yeah, the ordinance could be amended at any time. And if things are going really great, we could rescind the emergency proclamation or repeal the ordinance. If things are going really badly, you may all want to think of other measures to implement. And so you have the freedom to do that. The ordinance just says if you do nothing, it will expire on November 30th.
Okay. Well, I think we maybe then should the last meeting of August just have a discussion about where we're at. I've heard a lot of people have heartburn about the November 30th date. I understand why with fall break and Thanksgiving and the last home football game, if the football season happens. So that date makes sense as far as that goes, but I have heard a lot of folks say, I support this, but I have some heartburn about the length of this. So just clarifying to everyone that we can revisit this at any time. We can make changes to it if we need to. But I would love to have, a review set up the end of August so people can know, hey, the council's not just gonna wait till November to think about this again. We are gonna be thinking about it all the time. And I don't think, speaking for myself, and I think for a lot of people, we don't want to have any kind of restrictions like this in place longer than we really want to. I don't really want to have to do this. All of this is unprecedented and it's uncomfortable and unpleasant. And I kind of just want to do what we have to do to get this over with as fast as we can. I don't know when that would be, but I think if we let people know that we are going to be talking about this on a regular basis, we're going to be reviewing this data and making changes if we see improvement, and not just saying, no, this is it, we're waiting until November. So that's my comments. Thanks.
I would clarify that the emergency management team that we've had put together since March, Dr. Cook, have we had 33 something meetings at this point? We meet weekly. We're now meeting bi-weekly. So we do review it regularly, but I think it's great to have the public discussion going forward. And I'd be happy to have one before August 30th. It'd be neat to do one before the students get back and after the students get back and see what we're dealing with. And it is unprecedented.
So I would support that too.
Okay, you have Councilmember Hall that has her hand up.
Yes, I just wanted to thank Councilmember Holman for putting this amendment forward for the reasons that I stated earlier in the conversations that I've had with our bar owners in Ward 4 in particular, but I'm sure it applies all over town. I will support this amendment, and I think it's prudent to review where we are, and I think that addresses a lot of the concerns about, I think, all the feedback that we've gotten about the November 30th date, which I completely understand in context, and I think was, we addressed that in some detail a little bit earlier, but I do support the idea of having a review in 30 days or so, 30 to 45 days. So in support of the amendment and in support of revisiting and reporting to the public where we are. Thank you.
So just to clarify, we are still on the amendment to strike the closing earlier. Are there any other comments on that? I think we have committed to a public discussion. The City Manager Pyle, please get us in August 14th, that week, whatever Tuesday that is, because I know that move-in is actually a week before school starts. So these students will have a week to just be in Norman. Just soak that one in. And then also in mid-August, so after they've been here for a month. But any other comments or questions about this amendment?
Councilmember Patron.
I agree with Councilmember Lee. Councilmember Hall. I too appreciate Stephen's experience here, having worked in these establishments, and I've also heard from bar owners. So they've been hit probably some of the hardest on this. So I look forward to keeping tabs on it. Hear that? Keep tabs at the bar. Anyway, I look forward to, making sure that I'm sure that the task force will be watching it, and I'm happy to talk about it before the students get here as well, Mayor Clark. But I do think that we need to, the whole idea here was to try to keep as many businesses open as we can. And I'm afraid that if we were to go to those hours, especially when their volume is reduced so much in the summer already, we're going to be limiting capacity here, but this may just be enough to be able to keep them open. So if we can do that, that's what we want to do. So thank you.
I'm seeing no other comments, Mayor.
Okay, then my comment on this and why I will not be supporting it is we already know they're hotspots. To the point, we have community spread so bad in our city that we can't track things. So I don't know what exactly more this council needs to take action on the areas that we know are trouble areas in our community. But that I won't be supporting it. I totally understand. I feel most for the employees. I bartended my way through college. That's how I paid for my college. I understand it, but we are in a pandemic. We are in a pandemic. I don't know what else to say. We've heard from 2 doctors today. One's in epidemiology, one's with our local hospital system. I don't know what much else can be said about it. So the more we wait to try and get a hold of this thing, the worse it's going to get. Any other final comments from council regarding this item?
Seeing none, Mayor.
Thank you. The amendment on the floor is to strike the last sentence in subsection B of section 5 of the ordinance, which reads, bars and the bar areas of restaurants shall close at 10 p.m. on weekdays and 11 p.m. on weekends. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Carter.
Aye.
Councilmember Patron.
Aye.
Councilmember Hall. Councilmember Wilson.
No.
Councilmember Scanlon.
No.
Councilmember Holman.
Yes.
Councilmember Scott.
No.
Mayor Clark.
No.
The amendment passes by a vote of 5-4. Voting against, Councilmember Wilson, Councilmember Scanlon, Councilmember Scott, and Mayor Clark.
Thank you, Madam Clerk. Are there, okay, sorry, this seems out of order. The motion on the floor. Are there any questions from council regarding this entire item as amended?
On second reading.
On second reading.
Bill, do you have a statement now?
Yeah, I do.
Councilmember Scanlon, I'm sorry. Okay, go ahead.
And I really spoke to this before our last week's discussion. I want to state categorically that I am all for masks. I think they serve a very useful purpose. I think they're very important. The issue I have with this ordinance is one, not so much of compliance, but of enforcement. Compliance is what we would hope for. Compliance can be achieved many ways, to include an aggressive educational program, providing masks in stores that we've talked about as being our intent. But I don't see how it's enforced. In and of itself, it's not enforceable. It depends on something else, as I understand it, whether it's trespassing or some kind of public nuisance claim, which exists anyway. So I have a philosophical problem with the ordinance, not with the wearing of masks. I aggressively defend wearing masks. I wear them myself. I try to set that example. So that's the first point I would make. The second one, and this is relating to some of the public comments we heard. I absolutely reject that my colleagues are railroading this thing through, having participated in discussions over these past few weeks, talking about the pros and cons and so on. I reject the conspiracy theories. I inject the constitutional lawyers that we heard tonight telling us what we can and can't do. I think that this ordinance will likely pass. I think it'll probably be 8-1. But I respect the integrity of my colleagues in this vote, and I find them to be honest in their discussions and at the conclusions that they reach. I've stated my objection, and it's more philosophical relating to enforcement than anything else. But the idea of masks is a good thing. Thank you.
Councilmember Carter.
Okay, unmuted, right?
Yep, you're good to go.
Okay, well, I just wanted to make a comment about why I'm strongly in favor of this. And I have a favorite, one of my favorite sayings is safety first. And when I think of my 87-year-old father, I think safety first. And when I think of my stepmother, who I dare not say her age, I think safety first. And when I think of my grandchildren, I think safety first. This is one of those issues where safety first is the guiding principle here. I am a small business owner, and actually I'm a partner or owner in 5 different small businesses in and around Norman. And when I think of our employees, I think of safety first. And I'm a veterinarian for 36 years, and every week I do surgery. And for 36 years, every week, I've worn a surgical mask. And I don't wear a surgical mask to protect me from my patient. I wear the surgical mask to protect the patient from me. And they are very effective, and they're very safe. And this issue has become politicized. It's become partisan. It's become an issue about vanity, and there are all the wrong reasons. We've heard from the experts that this will help flatten this curve. I think I saw 58,000 new cases in the United States today. I heard that the testing turnaround times are decreasing because of capacity challenges. Oklahoma had a record number of cases. And so just like Dr. Raskob said, we don't want to be making these decisions when we have healthcare capacity infrastructure issues. We want to be proactive. We want to look forward. I believe our city attorney, when she tells us that we have the constitutional authority to make decisions on behalf of the public health. And that's what we're doing here. We're not doing anything other than that. You know, we're doing something that we believe will help flatten this curve. And as a small business owner, again, what was really bad for our business is when we were closed. And so if we can somehow flatten this curve, change the trajectory, which I'm hopeful this does, and it may not. It may not. There may not be the level of compliance that is necessary to change this. And as a large animal veterinarian, I deal with infectious disease outbreaks and herd situations all the time. And this concept of herd immunity, I've never seen it in a herd of large animals, horses or cattle. Swine, I have a lot of experience with in my early days, until you have a vaccine. And so, and 60%, protection is not herd immunity in my book, and I'm sure, people are different than animals, but if I want to vaccinate a herd of horses against flu, I want that vaccine to be, 90% effective, to protect that, those 10 in the herd that just don't respond to the vaccine appropriately. And that's the concept of herd immunity. And so we've got to do this. I think we have the authority to do this. And I'm very excited that we're taking an aggressive, proactive stance here, and I commend this council for being thoughtful in regard to public health. Thank you.
Councilmember Wilson.
Okay, I have a question for Catherine Walker, and then I'll make my final comments. I just want to clarify something. Catherine, are you available on there?
Sure.
I know we've talked about open carry twice, but did we talk about concealed carry? Because somebody texted me that they wanted to know about concealed carry specifically with the masks. Is it the same? I'm not familiar with those laws.
Yeah, to my knowledge, there's nothing about specifically about concealed carry or open carry relating to masks. It's really just this one statute that I've been able to find that talks about you can't wear a mask, during the commission of a crime or with the intent to deceive or, whatever, things along those lines.
Okay, it's the same. I just wanted to make sure, because I know Stephen and I both, or Councilmember Holman, sorry, and I both said open carry, but I didn't know if there was a difference. So thank you for clarifying that. And I just want to say that I will be voting to support this mask ordinance, and I understand that that's going to make a lot of people in our community very upset with me, as pretty much everything I'm doing right now makes people eating my pizza tonight made people upset with me. So I just want to say, to reach herd immunity by doing nothing means that people have to die. And I don't really want to go down that route if we don't have to. So I'm listening to Dr. Gary Raskob. I'm listening to Dr. Kate Cook, and I've done my own set of, internet PhD research. And I feel like we have a very minimally invasive set of standards here that we can all do to protect the most vulnerable citizens in our community. And it really, really is not going to hurt you. So good luck, everybody.
Councilmember Petrone.
I had a final question for Ms. Walker too. I read some comments that people felt like this vote would not be legal based on the council members that are, this is their last meeting and then we're swearing in new ones. Can you speak to that? And then I'll give final comments too.
Sure. So per the charter, the terms of the outgoing council members expire the second Tuesday of July. It doesn't specify a time. And in the charter, it also says that each elected officer shall continue to hold and perform the duties of his office until his successor is elected and qualified. Qualified means sworn in pursuant to the charter. So obviously we haven't sworn in our new members yet. We'd want to vote on these items before midnight, but other than that, there's no issue with the current council voting on the items.
Okay, and I feel like this happened.
Can I comment on that, Councilmember Patron, as well?
Sure, I felt like it happened not too long ago anyway. When I was sworn in, that council members voted on something that night too.
I had to vote on the Ward 5 replacement when I was first sworn in, but that was the new thing. So I went back and forth about this. In my head originally, I thought the new council members would vote on it because they're the ones that are responsible for making changes to it and whatnot. But then it was pointed out to me that one of our council members has been a council member elect for a week, so has not really had time to collect a lot of the resident feedback that we all rely on. And they got their iPads today. I don't even think they have them today, so they have no access to the emails we received. And this council has been following the pandemic from the beginning. And so I think tonight, if you've noticed, they've all been on here, everyone watching and listening and paying attention and soaking it all in. But and I've talked to all three of them about what if they wanted to vote on it or not. And based on the feedback that I've received from staff and from these council members, I'm comfortable letting this council vote on it and since they've heard everything tonight and all of our discussion, and now that they'll be able to get actual resident feedback via email and have time to do that appropriately, that they will be better suited to make any adjustments going forward.
I didn't have any personal problem with it. I just felt like we needed to get that question out there for the many members of the public who are bringing it up. Okay, so this has been a slog, to put it lightly, for me. I've gone back and forth with how to approach this, and for people who have been put forward constitutional arguments and personal liberty arguments, and those in particular were something that I really wanted to do my homework on. I actually even spoke with the constitutional law expert personally over this issue, and was assured that no, this is not a constitutional infringement of liberties by any stretch. Our case law is over 100 years for this particular type of issue, not mass particularly, but much more imposing examples have been upheld, and much deference has been given to municipalities and states and counties, especially for pandemics. And we are in the middle of a life-threatening pandemic for which there is no vaccine yet. I know that they are working hard on it, and I feel like that we're getting better treatments out there, and the outcomes are improving. But right now, I don't think that the people that well, a lot of the comments that I read, and much are like what council member and spoke to people, much like what Councilmember Scanlon had mentioned, really supporting mask wearing, but felt like that maybe it was a bridge too far to mandate it. So really, this particular ordinance they're not the problem. The problem are the bulletproof and invisible crowd that, you have to do something like this, or it ends up having the exponential spread that we're seeing right now. And the numbers that we're seeing today being a reflection of 3 weeks ago is I mean, we have to take this seriously. So when I felt, the other thing I had spoken to this scholar about was the ADA side of this and saying, okay, well, what do we need to do there? And he had told me that it's important for council to remember that medical exemptions and ADA exemptions, and this has been brought up to some degree tonight, but the accommodations are on the other side. It's not a license to go wherever you want to go because you have an ADA, you know what, for whatever reason you feel like you don't wear, you shouldn't wear a mask. It's the opposite side. So these business owners or public establishment keepers, whatever it is, need to offer online alternatives or delivery or whatever. So that was something that I feel like the conversation in a lot of these pages kind of derails. It's important to remember that the council has taken that, and city attorney, Catherine's done amazing work on this, but you're really going over and beyond to make sure that we are making sure that the accommodations are made in whatever creative manner each individual establishment needs to put into place. So the next part, having spoken with several of them, trying to hit the most common ones that were brought up to me and what I did to remedy those, to make sure, because had it been that I was told, Allison, yeah, you're violating constitutional liberties and you should know better, shame on you, I would not support this. But the record with the Supreme Court and every federal court has been clear for over 115 years now. And if you don't think that that's the case and you feel like that it's any sort of ordinance that we would put into place that for public safety is a violation of liberties, I would say try, see what happens when you go drive on the wrong side of the interstate. It's a public safety violation and you don't have that liberty to do that because it puts other lives at risk. And so the idea of your rights end where mine begins, when you're sharing airspace, to say it's my choice to exhale a bunch of droplets or whatever, and it's my choice to do that, and I'm going to do that. Well, what you've done is polluted the airspace that somebody else needs to have clean. So do I like masks? No, they suck. I'm not a fan. I really don't think that they're fantastic at all. Do I want this to last even until November 30th? Nope, I don't. I'm afraid it's going to, because of the numbers that we have right now being a reflection of 3 weeks ago. But I don't think that the people who are actively engaging in these conversations online are necessarily the people that are causing this. Again, I think it's the bulletproof and invisible crowd that, they're oblivious to it until there's a sign on the front door and somebody saying, hey, we'd love to have you in here. Here's a mask. And then we need you to come in because we're in the middle of a pandemic. So that's how you get people to take it seriously and save some lives. And if we get this wrong, and the numbers don't come down, well, people had to wear a mask, and that was really inconvenient and kind of sucked for all of us. If we get it wrong because we don't pass it, the alternative is what Councilmember Wilson was saying, and there were a ton of unnecessary deaths, like our doctors have been telling us. And I'm not a medical professional. I've got to listen to them. And people were bringing up, well, why didn't you hunt somebody down that has a belief in the other side? There's not any. That's why. There's not a bunch of crackerjack doctor licenses out there. So I find that really, sorry, that part makes me mad because they go to school for a really long time and all they're trying to do is save us. They're trying to cause the least amount of harm and keep us well. So we're doing the best that we can, and I hope that you all, I agree with Councilmember Wilson. I'm sure people are going to be mad at me, and you know what? It might be so mad at me that they decide they're going to recall me. Well, I would rather be recalled and not have a bunch of unnecessary death out there that was, I could have done something about. Because if it's on my hands, I would rather not have this seat if it means that enough people were mad at me that, you know, they thought, why not just let them die? Then if that's the case, you know what, this job wouldn't be for me, because for me, if I'm not doing this for any other reason than to try to make life a little bit better for people, I mean, that's why I couldn't sleep at night if I just decided that people's lives weren't worth it. So I'm going to support it. Shocker, right? After that whole spiel. And I appreciate the doctors. Thanks.
Councilmember Bierman.
So I'm just going to make a brief final comment. Today alone, I responded to 241 emails. I'm sure there were some that I missed. Some of them stacked up weird, and so I called someone by the wrong name earlier because I thought I was responding to a different email in the email chain, and that was really embarrassing. Fielded probably 20 phone calls today and dozens over the last few days, and while I didn't keep an official count, there were certainly more in support of the mask ordinance than not, and particularly in Ward 1. And I am not surprised as to why, because as I have said multiple times and will continue to say it because it's really important, Ward 1 contains the lowest income census tracts in the whole city. These are people who tend to work high exposure service jobs. They tend to not have health insurance or affordable access to health care when they can get it. Even testing, if they can't get it at the county health department because it takes a week to get in for a test, then they need to pay $60+ to Norman Regional or an urgent care to get a test. And they don't have paid time off of work because they typically work hourly wage jobs. And what it really boils down to for me is that the vulnerable and immunocompromised in our city have just as much of a right to move safely through this city as anyone else. And by not passing a mask ordinance that shows them that they can go into stores safely, because not all of them have the luxury of ordering their groceries online. Not all grocery stores accept EBT cards for food stamps. Not everyone has that luxury. That is the privilege, to be able to get your groceries delivered to your house. Like if you are a single parent with a child who has brain cancer, you cannot leave your child home alone. These people do not have other options, and they are residents just as much as everyone else. They pay taxes just as much as everyone else, and they deserve to be able to move through the city without fear of contracting this virus. And so what it comes down to for me is that these are people who make very significant sacrifices in their lives to try and keep themselves safe. And so on the rare times that they do need to go out, they need to be protected by us. And it is endingly disappointing for me that there are people in this community who can't find the compassion and the willingness to accommodate that in others. And so, like several others said, if this is the reason I am recalled, then so be it. I happen to know that Ward 1 residents are being seriously affected by this virus, by their inability to go out and move about the city the same as those who are not immunocompromised or elderly. And so that is why I will be supporting this ordinance. I do think that it's right that we go back and continue to revise it and review it and make sure that we are taking a targeted approach. I will be supporting this tonight.
Councilmember Holman.
Thank you. Just pretty briefly, I think a couple things I just wanted to get on there just for us to think about going forward. A couple comments from Officer Sean McKenna that he mentioned earlier in his public comment. I do have some concern about increased calls for service to the police, and I do want to reduce interactions between the public and the police as much as possible. So I do think those are some valid points he made about maybe whether it's the action center or something else where we kind of direct this. I'm not sure, but something to think about. If do we want everybody calling 911, that type of thing. So I think those are really valid points that he pointed out. And I would also ask City Legal to think about his comment about deleting the similar offenses part from the ordinance and what similar offenses could mean, and whether that is giving the police kind of a broader range of ability to enforce this. Some have pointed out that could be not in a good way. So anyway, that's something we just might think about as we're, continuing to think about this ordinance as time goes by. But I think those are valid points. So I've gotten around 700 emails, I think, about this specific thing. It's a lot of copy and paste, but the header is, the same and generally. It's probably the issue I've gotten the most emails about, most single issue I've gotten the most emails about in my whole time on council in 7 years. I was contacted by 125 Ward 7 residents, which would be the most that have ever contacted me about any single issue. Not surprisingly, 102 of those were for the city taking this type of action. Ward 7, again, it's not surprising to me, would overwhelmingly support something like this. That almost the entire university campus is in Ward 7. Lots of apartment complexes. I have several assisted or independent senior living centers in Ward 7, I think 3. So I have tried to respond as many as I can. I'm going to keep responding tomorrow and the next day, is however long it takes me to get back to, at the very minimum, all the Ward 7 residents that reached out to me, at least to respond. And I really do appreciate all of you that took the time to reach out to me, whether you were for or against our action. I do take all of your comments seriously. I do take them into consideration. On every vote that I've ever made from this seat, I listen to everybody. And just because I may not vote the way you want, it does not mean that your voice does not matter to me and that your opinion does not matter to me. It does. And it always helps guide me into making a better decision the more people I hear from. So for and against. So I appreciate all of you. Based on the feedback that I have received and based on the information we have received from medical experts in locally, the county health department, statewide, I am going to support this ordinance, and I do look forward to continuing to discuss this and track this data and make adjustments as we see needed. So thank you.
Councilmember Hall.
So we've worked through a lot of different issues tonight, and I appreciate the diligence that all of my colleagues have taken in considering this issue. There are 3 things that the experts that we have relied on our emergency management team and others agree on that every single one of us can do to reduce the spread of the coronavirus. Wear a mask when in public while interacting with another person in close proximity to you. When you do this, you're expressing your compassion for others by protecting them from your respiratory droplets. They in turn are expressing their compassion for you for doing the same thing. There's new evidence that you can also wear a mask for your own self-interest. And the information suggests that by wearing a mask, you will also gain some additional protection for yourself. They tell us to practice robust hand washing whenever we can, to maintain social distancing of at least 6 feet at every opportunity that you have. It's that simple. We are all in control of these 3 things. We can all accept the personal responsibility of doing these 3 simple things. So the Healthier at Home initiative was a staged plan to remove restrictions, and they were all removed as of June 12th. Since then, we've seen an increasing number of positive cases locally in our state, across most of the country. I think we're all aware of that. And we look at gating criteria every single day to evaluate what's going on. And we've been told repeatedly that the number of new cases is due to community spread, not by an increased number in testing. So while Dr. Raskob and Dr. Cook have stated tonight our hospital capacity in Norman is currently manageable, we are seeing a steady increase in the number of beds required for patients with COVID-19. And that number has jumped from 26 to 38 patients in just 1 day. We've encouraged, we've cajoled, we've tried to look at the science on why it's so important to mask for others since March 15th. It's all been voluntary. And as stated multiple times tonight, our primary responsibility as a governing body is to protect the health, the safety, and the welfare of our community. So we are at a crossroads today. I am in support of the mask ordinance because it is an action that we can all take, because I don't want to be put in the position of harming our businesses and their employees any further than we already have by having to shut them down to prevent community spread. We've done that already. I'm in support of this because whether the University of Oklahoma can successfully educate and house students this fall will depend on how we support their mandatory mask policy. The community spread we are experiencing right now, we've been told multiple times tonight, is in the 18 to 35-year-old age group. Building a culture of wearing a mask has to start now as we welcome back thousands of students that should be expected to do the same thing on campus as off campus. I'm supportive of this because if we have any hope of being able to enjoy the many things that we love about Norman, that involves being in community with one another and that we're all missing acutely right now, we have to give this a try. I'm willing to revisit this ordinance in 30 to 45 days to see how we are doing. I'm committed to bringing this back to council to amend or rescind if needed as we determine the effectiveness of this ordinance and how it's going to work.
I'm seeing no other council comments, Mayor.
All right, I will conclude my comments with simply, you know how I'm going to vote on this. It's obvious. It's data-driven and science-based, and our doctors are telling us that's what we need to do. I'm just hopeful that, like with the shutdown, Norman started it and the rest of the state followed. So I hope other mayors are listening. I hope Governor Stitt is listening. Because by God, if Texas can do it, then we can do it too. Our residents are worth it. That's what our vote signifies tonight. Our residents are worth it. So with that, the motion on the floor is to adopt the ordinance on second reading as amended. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Carter,
It's a no-brainer, yes.
Councilmember Petrone,
Aye.
Councilmember Hall,
Aye.
Councilmember Wilson,
An enthusiastic and pizza-fueled yes.
Councilmember Scanlon,
A reluctant no.
Councilmember Holman,
Yes.
Councilmember Scott,
Yes.
Mayor Clark.
Yes.
The ordinance is adopted upon second reading by a vote of 8 to 1, voting against Councilmember Scanlon.
Okay. We should now be on the emergency section 8, correct?
Correct.
I will entertain a motion to adopt or reject emergency section 8.
Moved.
Second.
The motion on the floor is to adopt emergency section 8. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Carter,
Safety first, aye.
Councilmember Petrone,
Aye.
Councilmember Hall,
Aye.
Councilmember Wilson,
Yes.
Councilmember Scanlon,
No.
Councilmember Holman,
Yes.
Councilmember Scott,
Safety first and then teamwork. Yes.
Mayor Clark.
Yes.
The emergency section is approved by a vote of 8 to 1, voting against Councilmember Scanlon.
Thank you, Madam Clerk. I will now entertain a motion to adopt or reject the ordinance on final reading.
So moved.
Second,
The motion on the floor is to adopt the ordinance on final reading. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Carter,
yes.
Councilmember Petrone,
Aye.
Councilmember Hall,
Aye.
Councilmember Wilson,
Yes.
Councilmember Scanlon,
No.
Councilmember Holman,
Yes.
Councilmember Scott,
Yes.
Mayor Clark.
Yes.
The ordinance is adopted upon final reading by a vote to 8 to 1, voting against Councilmember Scanlon.
Thank you, Madam Clerk. I also want to again thank Dr. Razkob and Dr. Cook for your time this evening. It's a long meeting, but it may be one of the most important meetings these council members will ever have, and that is just a fact. And your guidance has been incredibly helpful, and I can't thank you enough for your time. But let's get some new council members sworn in before midnight. Who's with me? Let me be the first to welcome you to the Norman City Council. So, administering the oaths of office to and seating of council member elect David Perry, Ward 2, council member elect Elizabeth Lee Hall, Ward 4, council member elect Elizabeth Foreman, Ward 6, and council member elect Matthew Peacock, Ward 8. I would like to recognize Judge Drew Nichols to administer the oaths of office to these council members elect.
Thank you, Mayor Clark. All right, the four of you will raise your right hands and repeat after me. I state your name.
I, David Perry,
Foreman.
Do solemnly swear.
do solemnly swear
Support, obey, and defend
I will support, obey, and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of Oklahoma,
and the Constitution of the State of Oklahoma.
and that I will not knowingly receive,
I will not knowingly receive,
directly or indirectly, any money or other valuable thing
any money or valuable thing
for the performance or non-performance
for the performance or non-performance
of any act or duty pertaining to my office,
of any act or duty pertaining to my office,
other than the compensation allowed by law.
other than the compensation allowed by law.
I further swear
I further swear
that I will faithfully discharge my duties
that I will faithfully discharge my duties
as council member to the best of my ability.
as council member to the best of my ability.
David Perry in Ward 2, Lee Hall in Ward 4, Elizabeth Foreman in Ward 6, and Matthew Peacock in Ward 8. I declare you duly sworn and seated to the office of council member for the city of Norman.
Thank you.
Thank you.
Thank you.
Thank you.
Welcome to the team. And Judge Nichols, thank you for your patience as well. That was a long time in a robe outside of the courthouse, I'm sure.
You're welcome.
But
I'm ready for bed.
All right, thank you, sir. We appreciate you. Have a good night.
You too.
I will now entertain a motion to nominate Councilmember Holman as Mayor Pro Tem.
So moved.
Second.
All right, the motion on the floor is to approve the nomination of Councilmember Holman as Mayor Pro Tem. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Perry,
Aye.
Councilmember Patron,
Aye.
Councilmember Hall. Aye. Councilmember Wilson,
Yep.
Councilmember Foreman,
Aye.
Councilmember Holman,
Yes.
Councilmember Peacock,
Yes.
Mayor Clark.
For my buddy Snake, of course, yes.
Snake Plissken from Escape from New York. Just a comment real quick, if I may.
Motion passes unanimously, by the way.
Go ahead, Councilmember.
I just am very excited that our new council member's first vote got to be to make me the mayor pro tem. That's very exciting. And I really appreciate all of your support. I'm very much looking forward to working with you over this next year or however much time we have left. I'm not sure. But I always like to tell everybody every year, now that I'm the by a long period of time, the longest serving council member. I'm entering my 7th year, and I've served twice as long as Mayor Clark, who's the next longest serving council member. And then after Mayor Clark, we have council members Wilson and Bierman. And overall, this is a very young city council in time served and experience. And it's just, by my tally, I will have served with 24 different council members and 3 mayors so far. Matt Peacock will be the 5th Ward 8 council member that I've sat next to. And Elizabeth Foreman will be the 5th Ward 6 council member that I've sat next to. So I don't know. Nobody wants to sit next to me for very long. They move on. So anyway, just very exciting. I'm really appreciative to get a chance to work with all of you that I've been working with on council and our new members as well. So we've got a lot of work ahead of us. A lot of people will tell us they don't envy us having to sit in this seat and listen and take in the things we have to do and make the decisions that we have to do. So we've got a lot of work ahead of us, but I think this is a good group that can that is up to the challenge. So I'm very excited. Thank you all so much.
Thank you, council member. All right, I'll now entertain a motion to nominate myself, Mayor Clark, as representative and Councilmember Hall as alternate representatives of the Oklahoma Municipal League Board of Directors.
So moved.
Second.
The motion on the floor is to approve the nomination of Mayor Clark as representative and Councilmember Hall as alternate representative of the Oklahoma Municipal League Board of Directors. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Perry.
Aye.
Councilmember Patron.
Aye.
Councilmember Hall.
Aye.
Councilmember Wilson.
Yes.
Councilmember Foreman.
Aye.
Councilmember Holman.
Yes.
Councilmember Peacock.
Yes.
Mayor Clark.
Yes.
The ordinance passes unanimously.
Thank you, Madam
I'm
Clerk.
sorry, the nominations pass. I'm really tired.
We appreciate you so very much. Item 8, election of a representative and an alternate representative to the Association of Central Oklahoma Government Board of Directors. I'll entertain a motion to nominate myself, Mayor Clark, as representative and Councilmember Holman as alternate representative of the Association of Central Oklahoma Government Board of Directors.
So moved.
Second.
The motion on the floor is to approve the nomination to nominate myself as representative and Councilmember Holman as alternate representative of the Association of Central Oklahoma Government Board of Directors. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Perry.
Aye.
Councilmember Patron.
Aye.
Councilmember Hall.
Aye.
Councilmember Wilson.
Yes.
Councilmember Foreman.
Aye.
Councilmember Holman.
Yes.
Councilmember Peacock.
Yes.
Mayor Clark. Mayor Clark.
Yes.
The nominations are approved unanimously.
Sorry, if you said my name the first time, I didn't hear it. Now on to item 9, election of a city council member to serve on the board of trustees for the City of Norman Retirement System. I'll entertain a motion to nominate Councilmember Wilson to serve on the board of trustees for the City of Norman Retirement System.
So moved.
Second.
The motion on the floor is to approve the nomination of Councilmember Wilson to serve on the board of trustees for the City of Norman Retirement System. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Perry.
Aye.
Councilmember Patron.
Aye.
Councilmember Hall. Councilmember Hall.
Aye.
Councilmember Wilson.
Yes.
Councilmember Foreman.
Aye.
Councilmember Holman.
Yes.
Councilmember Peacock.
Yes.
Mayor Clark.
Yes.
The nomination passes unanimously.
Thank you, Madam Clerk. Item 10, Resolution 2021-8, extending appreciation to Joe Carter for serving as Ward 2 council member in Norman, Oklahoma. I need a motion to adopt the resolution.
So moved.
Second.
The motion on the floor is to adopt the resolution. Madam Clerk, will you please call the roll?
Councilmember Bierman.
Aye.
Councilmember Perry.
Aye.
Councilmember Patron.
Aye.
Councilmember Hall.
Aye.
Councilmember Wilson.
Yes.
Councilmember Foreman.
Aye.
Councilmember Holman.
Yes.
Councilmember Peacock.
Yes.
Mayor Clark.
Yes.
The resolution is adopted unanimously.
Thank you, Madam Clerk. A resolution of the Council of the City of Norman, Oklahoma, extending appreciation to Joe Carter for serving as Ward 2 council member in Norman, Oklahoma. Whereas the health and well-being of a democratic society depends on the active participation of citizens in the affairs of the government, and the level of government which is closest to the people is that of city government. And whereas those individuals who seek to run for public office at the municipal level do so out of deep caring and concern for the future of their community and bring their own unique talents, values, and abilities to the job while assuming the demanding task of establishing an understanding of the issues. And they do so in addition to work and family responsibilities and demands. And whereas those individuals who are elected take on the responsibility to establish public policy and to meet the challenge of complex issues and problems to the best of their abilities. And whereas Joe Carter served on the City Council representing Ward 2 from July 3rd, 2018 to July 7th, 2020. And whereas Joe was steadfast in his principle about three things: fiscal responsibility, animals, and trees. And whereas during Joe's term, City Council amended the city's tree ordinance and approved funding to reinstate the city forester and was an enormous advocate of Norman's existing tree canopy and its future growth. And whereas Joe is a true advocate of animals and nature and a proponent of environmental stewardship. Now therefore be it resolved by the Council of the City of Norman, Oklahoma, that the Council of the City of Norman, on behalf of the entire citizenry of Norman, commends and extends appreciation to Joe Carter for service to this community as council member for Ward 2 and wish him well in his future endeavors.
I just want to say thank you. You're making me cry, Mayor. I love each and every one of you guys. What we've been through, I mean, maybe the city council in 1915 with a pandemic or Second World War. I'm just trying to decide, but I feel just every single one of you are like my brother or sister, and I'm going to miss you. And I love each and every one of you. It's an experience that I will never regret. And I have so much confidence in what the city council and our city government has got going on that I'm very excited about it. And I'm very excited about David Perry, the new city councilman in Ward 2. I've known David a long time. He's a dedicated public servant, and you know, I look forward to him carrying the banner. You know, like the mayor said, I think Ward 2 is passionate about trees. You know, it's possible for us to have a 30% canopy in the city of Norman, and I'm passionate, and I think Ward 2 is passionate about the South Canadian River Park and seeing that come to fruition, and all of the social justice and re-examining policing and dealing with this pandemic in a thoughtful way that protects our citizens' safety first. And these are all things I look forward to seeing Councilmember Perry and this council move forward with. I just can't thank you so much. Like I said, I love all you guys.
Thank you, Joe.
Thank you. Thank you, Councilmember. All right. Our next item is item 11, resolution 2021-15, extending appreciation to Bill Scanlon for serving as the Ward 6 council member in Norman, Oklahoma. I need a motion to adopt the resolution.
So moved.
Second.
Second.
The motion on the floor is to adopt the resolution. Madam Clerk, will you please call the roll?
Councilmember Bierman,
Aye.
Councilmember Perry,
Aye.
Councilmember Petrone,
Aye.
Councilmember Hall, Councilmember Wilson,
Yes.
Councilmember Foreman,
Aye.
Councilmember Holman,
Yes.
Councilmember Peacock,
Yes.
Mayor Clark.
Yes.
The resolution is adopted unanimously.
Thank you, Madam Clerk. A resolution of the Council of the City of Norman, Oklahoma, extending appreciation to Bill Scanlon for serving as the Ward 6 council member in Norman, Oklahoma. Whereas the health and well-being of a democratic society depends on the active participation of citizens in the affairs of the government. And whereas the level of government which is closest to the people is that of city government. And whereas those individuals who seek to run for public office at the municipal level do so out of deep caring and concern for the future of their community and bring their own unique talents, values, and abilities to the job. And whereas those individuals who are elected take on the responsibility to establish public policy and to meet the challenge of complex issues and problems to the best of their abilities. And whereas these public officials assume a demanding task to establish an understanding of the issues, and they do so in addition to work and family responsibilities and demands. And whereas Bill Scanlon served on the City Council representing Ward 6 from July 3rd, 2019 to July 7th, 2020. And whereas Bill Scanlon championed efforts to educate and address issues related to stormwater mitigation and was an advocate for the constituents of Ward 6, participating regularly in neighborhood events and meetings and will continue to do so. And whereas throughout his tenure, Bill volunteered his services to and supported the Norman Police Department and the mediation program and worked tirelessly to address homelessness issues in our community. Now therefore be it resolved by the Council of the City of Norman, Oklahoma, that the Council of the City of Norman, on behalf of the entire citizenry of Norman, commends and extends appreciation to Bill Scanlon for his service to this community as council member for Ward 6 and wish him well in his future endeavors.
Yeah.
I guess I have to give a speech. I said when I was sworn in that I had big shoes to fill, replacing then Mayor Clark in Ward 6. And I meant it at the time, and I probably didn't anticipate the size of those shoes when I started out. But I hope that I did her justice in serving the second year of her Ward 6 term. I meant what I said earlier about the integrity of my colleagues on the council. I know there's been a lot of sniping going on, second guessing, impugning motives and so on, and I don't buy that. I've worked with you all long enough and been through the trenches and some difficult propositions that while we may not always agree, I sincerely believe that you have the best interests of your ward and the city at heart. And so I commend you for that, and I appreciate the opportunity to have participated. Elizabeth, I would offer you some counsel. You're going to meet some challenging times. Things that you don't anticipate today are going to confront you tomorrow or the next day. So fasten your seatbelt. It'll be fun, but it will be a challenge. Good luck to you. Thank you all very much.
Thank you so much.
Thank you, council member. And last, but certainly not least, item 12, resolution 2021-9, extending appreciation to Alexandra Scott for serving as Ward 8 council member in Norman, Oklahoma. I need a motion to adopt the resolution.
So moved.
Second.
The motion on the floor is to adopt the resolution. Madam Clerk, will you please call the roll?
Councilmember Bierman, I'm sorry.
Hi.
Councilmember Perry,
Aye.
Councilmember Patron,
Aye.
Councilmember Hall. Aye. Councilmember Wilson,
Yes.
Councilmember Foreman,
Aye.
Councilmember Holman,
Yes.
Councilmember Peacock,
Yes.
Mayor Clark.
Yes.
The resolution is adopted unanimously.
A resolution of the Council of the City of Norman, Oklahoma, extending appreciation to Alexandra Scott for serving as Ward 8 council member in Norman, Oklahoma. Whereas the health and well-being of a democratic society depends on the active participation of citizens in the affairs of the government. And whereas the level of government which is closest to the people is that of city government. And whereas those individuals who seek to run for public office at the municipal level do so out of deep caring and concern for the future of their community and bring their own unique talents, values, and abilities to the job. And whereas those individuals who are elected take on the responsibility to establish public policy and to meet the challenge of complex issues and problems to the best of their abilities. And whereas those public officials assume a demanding task to establish an understanding of the issues, and they do so in addition to work and family responsibilities and demands. And whereas Alexandra Scott served on the city council representing Ward 8 from July 3rd, 2018 until July 7th, 2020. And whereas Alexandra Scott was the youngest council member to ever serve on the Norman City Council. And whereas Alexandra was steadfast about the democratic process and a strong advocate and proponent for inclusivity and diversity in the city of Norman. Now therefore be it resolved by the Council of the City of Norman, Oklahoma, that the Council of the City of Norman, on behalf of the entire citizenry of Norman, commends and extends appreciation to Alexandra Scott for her service to this community as council member for Ward 8 and wish her well in her future endeavors.
Well, thank y'all. It's 11:11, so making a wish. I'm praying for all of y'all right now, moving forward, especially you, Councilmember Peacock. It has been a crazy, crazy couple of years, but I've learned a lot from almost all of you. Sorry, the new counselors, I don't know y'all very well, so I can't say like I've learned too much, but I know the struggle, so I have learned from all and developed relationships and served our community. It's been really interesting. Every year of council in Norman has been the way it has been for the past couple of years, but I don't know, maybe it's social media, but I will say that I am grateful to have been elected. I'm grateful to have been the opportunity to serve. I believe I did my due diligence, my research, all of that stuff. I was the youngest council member elected in the history of Norman that we know of, and that was really neat, but it also, some people thought I was just naive because I was young. And moving forward, it's something I may have to battle until I'm old, and then people will just think I'm old and washed up, and there's really no winning, especially for us as some of the women on council. We get hit really hard a lot of the time too, even for things as easy as like eating pizza or saying something. I don't know, right off the top of my head, but it has been wild. It's been crazy. I've been a fierce proponent also for a municipal income tax. Please don't let that just fall by the wayside. Don't let it go. Okay, I pray. Like I said, it was 11/11. That was my wish. Okay, y'all get it. And stabilize our general fund. Our finance director would be so happy. And then as well, I appreciate all of the time that y'all put in. Those of you, especially who've been on council for a very long time, Councilmember Holman, I will miss sitting next to you and being able to pick your brain during council meetings as well. So really appreciate you. And Mayor Clark also serving as a mentor and friend in the past couple of years. So I'm gonna miss you guys, but I'm still gonna be here. By the way, not getting rid of me that easy. So still have work to do. Councilmember Carter and I came on at the same time. And so I finished a bison for him today, his buffalo bison painting. That was what I was holding up earlier. That's for him. And now I move forward. I won my Democratic primary election last Tuesday for Senate District 15. I continue to run, and now I will be wearing masks at the door. Thank you, Councilmember Patron, for introducing that amendment to make sure that we're all being very safe. So thank you guys. I'll be, as soon as I can show up to City Hall, I'll make sure that you're hearing from me because like I said, you can't get rid of me. Been in Norman for a long time. Still really care about this community. Just won't have a vote on the dais. And I love you. I love you all. I appreciate all of our staff for putting up with me. Also, Brenda, shout out to you. And that's all. Good night.
All right. Thank you, council member. I just want to say to all three of you, obviously I know from experience, this is not easy. It's such a learning curve and you do it because you love it. And for those that are watching and think that we actually make money doing this, we make $100 a month and that's before taxes. And before I got a hybrid car, it didn't even cover gas. Like, it's insane. It really is a labor of love. We're the third largest city in the state of Oklahoma. We don't always get along. We don't always see eye to eye, but that's what you want. You want people with different opinions and constructive dialogue. And I assure you, every single one of these council members is incredibly hardworking and incredibly dedicated. And they're not here to make it a career. They're here to make their city a better place. And it is an honor to work next to each and every one of them. And I'm excited again to welcome our new members to the team. And I say team a lot because it is a team. You know, we have to work together. And again, we don't always have to agree, but we make each other better. And I look forward to the challenges ahead, as other council members have touched on. But I'll be quiet if anyone else wants to add anything. Otherwise, when this is all over, I'm taking all of you out for an adult beverage at a local brewery to shop local. Anyone else? I'll turn it over.
Councilmember Holman.
I want to extend my thanks to Joe, Bill, and Alex. As mentioned, this job isn't very easy, and it doesn't even pay like an actual job does. You really have to do it because you care about the place you live in. And that's what I love about city council and local government, is that it's the closest to the people, and that all of us on the city council, we all live in the same town together. And to me, living in the same town is a lot different than living in the same state or the same country together. And so I know on the city council, when we make decisions, I know that each one of you knows that that decision is going to impact you personally and your family as well. And if there's an issue in your district, I can go see for myself what is going on and talk with you about it. And that doesn't really happen at the state or federal level with our elected representatives. And so, you know, Norman is my hometown, fourth generation, grew up here. My dad grew up here. My grandfather worked at State Hospital for 42 years. And my great grandfather owned a business on Main Street for a long time. So I care deeply about Norman. And I am just so thankful to anybody that is willing to step up and take on the responsibility of this job and deal with the very difficult decisions that we have to make. Sometimes there is no right answer or good answer. Sometimes both choices are not great, and you have to pick which one might be the least hurtful or the least negative impactful to people. So it can be very difficult. It can be very rewarding too when you do something that does help people and you see it happen, or you vote for a building and you see it get built for the first time and you are pleased with the results. It's very nice to see that and see that you had a direct impact in making it happen locally. So thank you all so much for your service. Norman will forever be grateful for you, and the impact of your time on council will be felt by Norman residents for generations, I think. So thank you.
Councilmember Hall. You're muted, Councilmember Hall.
Thank you, Brenda, for taking good care of me always. First of all, I want to take a minute to thank the voters of Ward 4 to the 2-year term that begins today, as I complete the unexpired term that I was appointed to on September 10th, 2019. It's really been my privilege to represent you. I remain committed to providing a strong and proactive voice for Ward 4 that I say over and over, I believe is the heart and soul of Norman. And Norman's complicated story started here. Ward 4 residents, local business owners, our nonprofit groups are all engaged, committed, knowledgeable, passionate. Ward 4 is filled with a diverse group of thoughtful people with a wide range of opinions on all issues that we are currently facing. And along with the rest of us, we've all, addressed the civic engagement that we've seen over the last few weeks that's been remarkable in a lot of ways. And so for me personally, it's been a real struggle to respond in a timely manner to everyone, but I also, like Councilmember Holman said, I appreciate every single one of you who's reached out and shared your ideas and your concerns with me. I really respect the time and energy that it takes to communicate with all of us. And I do read and listen to all of the messages that I've been getting. Your activism energizes me to continue to do the work, to come prepared to every single meeting and do the best I can to consider all of the input that I've received as I cast each vote. The past 9 months, we've been committed and confronted with big issues that impact all of us. We're learning how to live through a pandemic together and address inequities that we see revealed in our city and our state and our country. And my hope going forward is that the conversations we've all started with one another will continue to be robust and heartfelt, and that we can continue to look for common ground where we can find it and build bridges and not tear them down. I want to personally thank Councilmember Carter, Councilmember Scanlon, Councilmember on council. I've learned valuable lessons from each of you that I will use in the future. And to Councilmember Perry, Councilmember Foreman, Councilmember Peacock, welcome to City Council. I look forward to working with each of you as we continue to build a diverse and inclusive city where we can all thrive and be proud to call Norman home. Thank you all for sticking with us tonight. And thanks again to Dr. Roscobb and Dr. Cook for hanging in there to the bitter end, and for all of the wonderful information that you've been able to share with us. I really appreciate it.
Councilmember Bierman.
So I already said my goodbyes to Dr. Carter in a previous meeting, so I'll focus this one on Councilmember Scott and Councilmember Scanlon. I really appreciated working with you both. You brought a diversity and perspective to this council that I really appreciated. That made me think of things in different ways. You made me think about things that I never would have considered, and I really appreciate that. And to council members Perry and Foreman and Peacock, I have no doubt that this is not the kind of situation you thought you would find yourselves in coming onto City Council when you filed back in December. There are no takebacks. You are now stuck with us. And I will say that every year since I've been on council, this will be the start of my 4th year. No year has gone the way I thought it was going to. There are always things that come up, some things that we and some things that we don't. It is always an interesting ride, and I really look forward to getting to know each of you, particularly Councilmember Perry as my seatmate. I've also gone through several. I've had 3 council members sitting next to me in my time right next to me on that side of the dais. So I look forward to working with each and every one of you. I have no doubt that we're not going to have a slow summer that we kind of typically expect on council, that we're going to continue barreling right along, tackling all the major issues we have to tackle. So good luck. Looking forward to working with you. And for anyone who would like to, Thursday, 4 o'clock, Oversight Committee meeting. And that'll be a good first start. I'm not sure who drew the straw to fill the seat, Joe Carter's seat on that committee, but I look forward to working with you on that and on all of your particular issues specifically related to your wards in the coming year.
Okay, Mayor, that's all the hands that are raised.
All right. Well, we did some hard stuff. We had some touchy-feely stuff in an appropriate way. And now let's adjourn this meeting and let's get to work. Good night, everyone.